Welcome to the audiobook edition of Cognitive Behavioral Therapy and Mindfulness. Introduction. Do you ever look at a friend or relative who always seems happy, self-accepting, and optimistic and wonder what their secret is? Why can some people ride the stormy seas of life and stay smiling, while others spiral down into despair whenever something goes wrong? The answer is actually quite simple. It all comes down to the way they think. Upbeat, self-assured people know that how you see the world and yourself makes all the difference. They know that to lead a great life, you need to learn how to get your mind working for you, not against you. In this audiobook, you're going to discover how to transform your thinking and completely overhaul your relationships and mental health. It won't be easy, but you'll feel the difference within hours. Practice the exercises in these chapters, and every area of your life will change for the better. This isn't an audiobook about always looking on the bright side. Life is a mix of the good, the bad, and the ugly. Everyone struggles. There's no special technique that can take away the normal trials and tribulations of being alive. But you can learn to rewire your brain and take a new approach when you hit a bump in the road. The approach we're going to focus on is called cognitive behavior therapy, more commonly known as CBT. CBT has been around for decades. It's a straightforward model that explains why we get stressed, depressed, and anxious, and what to do about it. Even better, CBT is backed up by lots of research. We know it works. Psychologists have shown that CBT is a powerful treatment for many conditions, including depression, anxiety, obsessive-compulsive disorder or OCD, phobias, stress, addiction, and procrastination. CBT can improve your confidence, boost your happiness, and make you more satisfied with life in general. If you've been feeling stuck lately and aren't sure how to move forward, CBT will give you clarity. You'll understand yourself better, move on from your past, and look toward a brighter future. Let's get started. What is CBT? Let's begin Chapter 1. Psychologists know that our genetic makeup, environment, and upbringing all shape our personalities. Some of us are naturally more or less optimistic than others. However, the stories we tell ourselves about the world, ourselves, and life in general also make a big difference. In this chapter, you'll discover exactly how this works. Why your brain is both your best friend and your worst enemy. Humans are blessed and cursed with the ability to tell stories. We aren't very good at observing situations as they really are, particularly when they involve someone or something we care about. Our brains are quick to impose some kind of meaning or narrative on any event, even if it leaves us feeling worse. Your brain, which is supposed to be on your side, can actually make your life harder. Once you understand how this works, you can start applying the principles of CBT to take back control over your own thoughts. Telling stories. An example. Imagine you are walking down the street. It's a beautiful sunny day, and you're feeling good. You see one of your friends ahead of you on the sidewalk, so you call out their name, but they don't turn around. They ignore you completely and keep on walking. How would you respond? You might think, "Oh, they didn't hear me, that's a shame." Or perhaps you might think, "Oh dear, maybe something has upset them. They usually love to stop and chat." Or maybe you'd think, "My so-called friend is avoiding me. Typical. Why is it so hard for me to maintain friendships?" However you'd respond, keep in mind that the facts remain exactly the same. You called out to someone you knew, they didn't turn around, and they walked away. But the story you tell yourself about the event will change how you feel. If you tell yourself that your friend probably didn't hear you, your mood won't change much. You will get on with your day and perhaps text them later to mention that you saw them in town. If you jump to the conclusion that your friend must have been upset, you may feel concerned and get in touch to make sure they are okay. If you decide that your friend ignored you because they no longer want to talk to you, you'll feel terrible. You might avoid your friend because, in your mind, they've made it clear that they don't like you anymore. It's your interpretation of a situation that makes just as much of a difference as what actually happened. Here's a quick exercise for you. Think back over the last 24 hours. Have you been telling yourself any stories that left you feeling sad or anxious? Could you have interpreted those situations in a different way that would have left you feeling good, or at least okay? CBT is all about changing the stories you tell yourself. Using the techniques in this audiobook, you'll learn how. The key assumptions of CBT. Every type of therapy is based on a set of assumptions. You can think of these assumptions as a kind of model of the human mind. CBT practitioners believe several key things. First, they believe that depression, anxiety, stress, and bad habits are caused and sustained by core beliefs we hold about ourselves, by thinking errors, or both. When we have irrational, negative beliefs about ourselves, other people, and the world in general, we start to tell ourselves stories that make us unhappy, anxious, and dissatisfied. Second, it's easy to fall into the trap of using the same thinking errors over and over again. For example, if you have depression, you probably see the world as a bleak, hopeless place that offers you nothing but sorrow. Your view of everything gets darker, you withdraw from situations that could make you feel better, and the cycle continues. Third, the way we see the world affects our behavior. If we view the world through a distorted lens, we won't adapt well to our environment or life's challenges. For instance, if you have anxiety, the stories you tell yourself about the world, that it is dangerous, for example, might make you reluctant to go outside. Fourth, CBT practitioners believe it's possible to focus on destructive thoughts and change them. With the right techniques, we can pin down how and why our thinking patterns make us feel so bad. We can then choose to change them. Finally, although someone's past might play a role in shaping their cognitive distortions, it's more productive to focus on the present. A CBT therapist might talk about a client's childhood to work out where their negative core beliefs come from, but they encourage clients not to dwell on them. The exercises in this audiobook don't require you to analyze your past in much depth. The emphasis is on helping yourself right now, so you can make progress quickly. Where did CBT come from? CBT started with the work of two men, Albert Ellis and Aaron Beck, in the 1950s and 1960s. Since then, other psychologists and psychiatrists have put together their own techniques and treatment programs based on these ideas. First, let's look at Ellis's ABC model. In 1955, an American psychologist named Albert Ellis proposed his ABC model. He believed that external events don't automatically trigger negative emotional responses. What really matters is the belief someone has about that event. We saw an example earlier when you imagined how you'd feel if a friend ignored you in the street. In the ABC model, A stands for external or activating events, B stands for beliefs, and C stands for consequences, which refers to emotions and behaviors. Our beliefs act like filters, and they determine how we react to our circumstances. What makes this model so special is that it can help you feel better even when you don't have much or any control over your environment. For instance, if you are in a job you hate, learning to think differently about your circumstances can help you feel better as you work to find a new position. Ellis developed his own brand of therapy called Rational Emotive Behavior Therapy, or REBT. REBT teaches clients how to identify their unhelpful beliefs, challenge them, and replace them with more constructive ways of seeing the world. Next, let's talk about Beck's cognitive therapy model. In the 1960s, American psychiatrist Aaron T. Beck was researching depression. Beck started his career as a psychoanalyst. His training in psychoanalytic theory taught him that mental distress was caused by unconscious processes. But he wasn't convinced. He didn't think it was necessary to probe a patient's subconscious mind to find the source of their problems. He thought that open, honest discussion about their conscious thoughts was more helpful. After talking to many patients, he concluded that people with depression tend to experience three types of negative thoughts. First, negative thoughts and ideas about themselves. Second, negative thoughts and ideas about the world. And third, negative thoughts and ideas about the future. He referred to these three types of thoughts as the cognitive triad. Beck noticed that his patients didn't feel able to control these thoughts. He labeled them automatic thoughts because they seemed to appear without warning. Some people refer to these as ANTs, which stands for automatic negative thoughts. In the early days, he called his treatment cognitive therapy because it focused on a patient's thoughts. However, later on, he and other professionals started looking at the relationship between thoughts and behavior, so cognitive therapy became CBT. Over a career spanning several decades, Beck carried out research with hundreds of patients. He and his colleagues discovered that CBT can be used to treat other disorders, including anxiety, eating disorders, schizophrenia, and bipolar disorder. CBT today. Ellis and Beck were CBT pioneers, and their efforts laid the foundations for other approaches that are considered offshoots of CBT. Here are just 3 examples. First, there's dialectical behavior therapy, or DBT. Developed in the 1980s by Dr. Marsha Linehan, DBT teaches clients how to accept their symptoms and problems while making positive change. DBT is delivered as a structured course that usually lasts around a year. Clients learn how to monitor their moods, identify the link between their thoughts and their feelings, and tolerate distress. They also learn how to think more rationally and apply everyday problem-solving skills. DBT was originally developed for people with borderline personality disorder, a condition marked by black and white thinking, mood swings, and rocky relationships. However, DBT techniques have also been used to treat other conditions. People with BPD are prone to judging themselves and others harshly, with devastating consequences. DBT teaches them to step back from heated situations, weigh up all sides of an argument, and preserve relationships while still standing up for their wants and needs. Second is acceptance and commitment therapy, or ACT. As the name implies, ACT teaches clients how to come to terms with their problems and come up with solutions that fit their morals and values. Like traditional CBT, ACT involves facing your thoughts and feelings even if they make you uncomfortable. The difference between ACT and other forms of CBT is that ACT emphasizes acceptance along with change. Unlike CBT practitioners, ACT therapists believe it isn't always a good idea to deliberately challenge negative thoughts. Instead, they teach clients how to spot their thoughts, tolerate them, and draw up healthy goals that align with their personal values. Third is mindfulness-based cognitive therapy, or MBCT. You've probably heard of mindfulness. It's become a huge buzzword in personal development circles. To be mindful is to deliberately slow down and notice what is happening around you. It's about focusing on the here and now, instead of ruminating about the past or worrying about the future. MBCT is a structured 8-week program developed by Mark Williams, John Teasdale, and Zindel Sigel. It's based on the work of mindfulness pioneer Jon Kabat-Zinn, whose research shows that meditation and other mindful activities can reduce stress and chronic pain. MBCT is especially effective for people who have suffered multiple episodes of depression. Mindfulness helps you spot unhelpful patterns of thinking and behavior before they take hold. So, what do all these treatments have in common? Although these therapies use different techniques and are based on slightly different philosophies, they share a few key things. They all encourage clients to identify their negative thought processes. They all teach clients to become their own therapists, and they all encourage a pragmatic, goal-setting approach to behavior change. As you listen to this audiobook, you'll use a variety of techniques based on several different therapies that all fall under the CBT umbrella. CBT in the therapy room versus self-help. Traditionally, talking therapy takes place between a client and a trained therapist. Most CBT interventions last around 8 to 12 weeks, although some people need more sessions. Therapy sessions usually last 50 to 60 minutes. However, not everyone has the time or money for therapy. Even if you live in a country with free healthcare, you might have to wait a long time to see a clinician. Self-help can be a great alternative. Research has shown that self-guided CBT can be an effective treatment for common mental health problems. In the UK, the National Health Service, or NHS, recommends self-guided CBT for some people diagnosed with mild to moderate mental health problems. CBT isn't a magic cure. CBT requires effort. Whether you work through the techniques alone or with someone else, you have to put in the work before you see any results. Simply listening to this audiobook won't change your life. You need to understand the concepts and be committed to practicing them over and over again. It takes time to change your thought patterns. Breaking habits is hard work. Homework. Homework is a big part of CBT. CBT therapists often ask their clients to use worksheets and diaries, both during and between sessions. A therapist might ask a new client to keep a mood diary for a week, or record their most frequent negative thoughts. Every chapter of this audiobook contains a few exercises to help you understand and benefit from CBT. Before you go any further, find a notebook and pen and keep them on hand. Whenever you start a new exercise or list, write the date at the top of the page. You don't have to show your homework to anyone else. Your notebook is for your eyes only. If you live with other people, you might want to keep it locked or hidden away. If you really don't like writing, you could use a note-taking or voice recording app on your phone or computer instead. Now that you know what CBT is about, it's time to start practicing some exercises that will make a big difference in your quality of life. In the next chapter, we'll see how CBT techniques can help you overcome symptoms of low mood and depression. To summarize this chapter, the stories we tell ourselves about what is happening in our lives make a substantial difference in our mood. CBT is based on the idea that our thoughts, which are also called cognitions, feelings, and behaviors, are all closely intertwined. By learning to challenge our unhelpful thoughts, we can feel better and choose new, healthier behaviors. CBT has inspired other therapies, including DBT and ACT. CBT can be given in a face-to-face setting, but self-help is also effective. Finally, keeping notes and completing written exercises is a key part of CBT. Chapter 2, CBT for Depression. Now we begin Chapter 2. Depression is one of the world's leading causes of illness and disability. Around 15% of us will have at least one episode, and suffering from depression puts you at greater risk of experiencing it again. In this chapter, we'll look at how CBT practitioners view depression. You'll also learn how to lift your mood fast using proven CBT techniques. What is depression? Depression isn't the same as a feeling of sadness. It's a mental illness with a specific set of symptoms that can only be formally diagnosed by a trained medical professional. To qualify for a diagnosis of depression, you need to experience at least 5 of the following symptoms for a minimum period of 2 weeks. One of these symptoms must be either a depressed mood or a loss of pleasure. The first symptom is a depressed mood that lasts throughout the day, most days of the week. Second is a loss of interest and pleasure in everyday activities, including hobbies you previously enjoyed. Third is a significant and unintentional weight change of 5% or more. Fourth is difficulty getting to sleep or sleeping too much. Fifth is feelings of restlessness or feeling slowed down. The sixth symptom is a loss of energy and fatigue. Seventh is feeling excessively or inappropriately guilty and ruminating over actual or perceived mistakes. Eighth is having trouble thinking clearly, problems making decisions, or finding it hard to concentrate. And the ninth symptom is having thoughts of death, suicide, or suicide ideation. A quick word of caution. If you suspect you have depression or are having thoughts of self-harm or suicide, you need to reach out to a doctor or therapist as soon as possible. Self-help guides can be very helpful, but they aren't a substitute for urgent medical care. You can always come back to this chapter when you have received a diagnosis and have started treatment as recommended by your doctor. What do CBT therapists believe about depression? As you know, CBT is based on the idea that the way we see the world affects our mood and behavior. But how exactly can your thought patterns lead to depression? In the last chapter, we saw how Aaron Beck's cognitive triad plays a key role in CBT theory. Beck devised 2 other concepts to explain what happens when someone is depressed. The first key concept is called self-schemas. A schema is a set of beliefs and expectations about a person, thing, or scenario. We have schemas about everything. For example, most of us have a restaurant schema. Your ideas about going out for a meal in a restaurant include expectations about menus, tables, chairs, servers, food, drinks, and so on. Although every restaurant has its own decor, staff, and food, the basic principles are the same. If you've been to a few restaurants, you have a good idea of what to expect the next time. Schemas are useful because they help us plan ahead and respond to new environments. They help us understand how to behave appropriately around other people. Just as you have a restaurant schema, you also have a self-schema. As you may have guessed, a self-schema is a set of beliefs about who you are and how you should act. Someone with a positive self-schema knows they aren't perfect, but they usually think of themselves as a basically good human being. On the other hand, people with depression often have negative self-schemas. If you have a negative self-schema, you may have beliefs like, "I'm just not good enough," or "I'll never be successful," and "I'll never get anywhere in life," or "Everyone leaves me, and I'll be lonely forever." Beck thought that difficult childhood events could lead to a negative self-schema. For example, if a young boy is bullied at school for a long time, he may grow into a man who believes everyone hates him. If you think poorly of yourself, you will be vulnerable to depression. A negative self-schema makes it hard to appreciate your achievements and enjoy relationships because you never quite believe you deserve them. Even when things are going well, you might find it hard to trust other people. Let's try an exercise called completing sentences. Sentence completion exercises can help you uncover the negative self-schemas that are holding you back. In your notebook, complete the following sentences. Don't overthink this. Write the first thing that comes to mind. I am the sort of person who, in my experience, the world is. When I think of the future, I think. This exercise can be quite illuminating. You might be shocked to discover just how negative your thoughts have become. Your negative self-schemas might keep you trapped inside a cycle of negative thoughts and behaviors. For instance, if you always think that the future is bleak and that things will never get better, you might not bother to make plans or work toward goals. The second key concept is called faulty processing and logical errors. Negative self-schemas go hand in hand with logical errors. Logical errors are self-defeating patterns that keep you trapped in an unhealthy state of mind. They are also known as cognitive distortions. Here are a few of the most common ones. First is black and white thinking. When we're depressed, we often lose sight of the fact that life is neither perfect nor terrible. Instead, we are quick to judge things and people as bad or good, including ourselves. Also known as polarized thinking, black and white thinking keeps you from appreciating the nuances of everyday life. Second is overgeneralizing. If you tend to overgeneralize, you focus on one poor outcome or event and decide that it's bound to happen again. You assume that a single setback dooms you to a miserable future. For example, let's say you give a presentation at work that doesn't go very well. Your boss pulls you aside and gives you advice on how to improve next time. A non-depressed person might be a little down for a while, but they would probably act on their boss's feedback. However, someone with depression might assume that all their future presentations are doomed and that their whole professional future is in jeopardy. Third is the fallacy of change. Most of us are guilty of trying to get other people to change. Unfortunately, expecting others to change just to suit your agenda will make everyone unhappy. If you are stuck in this cognitive distortion, you believe that everything in your life will be better if the rest of the world gives in to your demands. For example, a man might believe that his marriage will improve if his wife joins a gym and loses weight. Fourth is the just reward fallacy, also called the heavens reward fallacy. As we all know, life isn't fair. However, that doesn't keep us from feeling resentful when things don't go our way. Many people with depression think that if they do everything right and treat others properly, they will somehow be rewarded. Unfortunately, if you hold this view, you'll be disappointed over and over again. Healthy people know that it's great to try your best, but we don't always have control over the final outcome. Fifth is emotional reasoning. When you're in the grip of intense emotion, logical reasoning can fly out of the window. For example, if something makes you feel upset or scared, you might leap to the conclusion that it must be bad. If a depressed person is nervous about going on a date, they might assume that this means it will go wrong, and they probably shouldn't go at all. Sixth is using the word shoulds. People with depression often use the word should a lot, both in reference to themselves and others. Even if you don't try to tell everyone else what to do, shoulding yourself isn't much better. Beating yourself up for not living up to a set of unrealistic or arbitrary standards will keep you locked in a state of self-criticism and depression. Seventh is personalization. When you personalize an outcome, you assume that you caused it, even if you have no evidence. For example, suppose that your partner didn't get the promotion they wanted. If your first thought is something like, "If I'd been nicer lately, they would have gotten it. I'm a terrible person," that's personalization. When we're depressed, it feels as though we can't do anything right and that everything is our fault. Eighth is catastrophizing. Also known as blowing everything out of proportion, catastrophizing involves giving negative events more weight than they deserve. When you catastrophize, you conjure up worst-case scenarios in a matter of seconds. For example, suppose you forget to pick up your partner's suit from the dry cleaner. If you are a catastrophizer, you may tell yourself things like, "I'm such an awful partner. We'll get into a fight, they'll leave me, and then I'll be alone forever." Ninth is filtering. When someone is overly optimistic, we say that they're wearing rose-colored glasses. If you're depressed, you're wearing gray-tinted glasses instead. If you focus on unpleasant details and ignore the bigger picture, you are filtering. 10th is blaming. People with depression assume that others have the power to make them feel a particular way. But this is a fallacy. Suppose someone insults you. How you feel is determined by your approach to the situation. When you blame someone else for your own emotional state, you are surrendering your power. Finally, the 11th error is mind reading. Do you assume that you just know what someone else is thinking? Do you think you can tell when others are judging you? Mind reading can make you feel depressed, fast. For example, if you tell yourself, "Oh, so-and-so didn't return my email, she must think I'm completely incompetent," there's a good chance you'll feel bad. Depressed people are quick to assume that everyone is thinking the worst of them. In reality, most people go through their daily lives thinking only about themselves. Here's an exercise. As you listen to that list, did any of those errors stand out for you? Note that you can be very depressed and only use one or two of these distortions, so don't be surprised if you didn't recognize most items. Over the next few days, challenge yourself to spot your distortions. The 3 steps to more realistic thinking. Now, you're about to learn a popular CBT technique that will let you take back control of your thoughts. It's called cognitive restructuring. Cognitive restructuring isn't about living in denial or wishing your problems away. You don't have to force yourself to think happy thoughts all the time. The aim is to process your thoughts in a balanced, rational way that leaves you feeling better about yourself and life in general. At first, cognitive restructuring might feel a little forced. It can be hard work, especially if you have been caught up in logical errors and self-loathing for a long time. The good news is that it gets easier the more you do it. There are 3 steps. First, identifying an unhelpful thought. Second, weighing up the evidence for and against the thought. And third, coming up with a rational, more helpful alternative. Let's look at each step in more detail. Step 1 is identifying an unhelpful thought. Because negative thoughts are often automatic, it's hard to notice them. You can use your emotions as a signal that your thoughts are making you anxious. The next time you feel distressed or worried, ask yourself what you were thinking just before the emotion set in. Use your notebook as a thought record. Jot down the thought together with a number denoting how strongly you believe it. A score of 0 means that you hardly believe it at all, and a score of 100 means you believe it completely. Automatic negative thoughts, or ANTs, are normally short, specific, and seem totally believable. However, if you look closely, you'll notice that they don't pop up after a sequence of logical thoughts. They tend to have a life of their own. You'll also realize that they usually involve the logical errors we just discussed. Let's try an exercise called spotting your ants. If you are depressed, you likely have lots of ants. Tomorrow, keep a running tally throughout the day. Whenever a new ant pops up, write it down. Every time it appears again, add another mark. At the end of the day, count up the marks. Are you very harsh on yourself? Step 2 is weighing the evidence. Your next task is to step back from your thought and work out whether it is actually true. No matter how believable an ant may seem, it probably isn't grounded in fact. Ask yourself these questions. What would I say to someone else in this situation? If I didn't feel depressed, how would I look at the situation? How would someone who isn't depressed or anxious look at the situation? Is there any objective evidence that my thought is true? In your notebook, draw a table with 4 columns. Label them thought, evidence for this thought, evidence against this thought, and more helpful way of thinking. Stick to facts, not subjective opinions. Let's see how this exercise can work in practice. Suppose you were dating someone you really liked, but they suddenly ended the relationship, saying they didn't feel you had good chemistry. You think to yourself, I'll be alone forever and no one likes me. Here's what you might write in your table. In the thought column, I'll be alone forever and no one likes me. In the evidence for this thought column, you might write, someone ended a relationship I thought was going well, so this means they don't want to be with me. In the evidence against this thought column, you could write, I have had friends and dates in the past. This means people enjoy my company. Most people have to date quite a lot before they find a long-term partner. Most people do not end up alone forever. Not everyone would be a good match for me, and this is true for everyone else. Step 3 is coming up with a rational, more helpful alternative thought. A good alternative thought is reasonable, fair, and compassionate. In the example above, a more helpful way of thinking about the situation might be, I am disappointed that the relationship didn't work out, but there are lots of other people to date. Or, I can take some time to recover from this setback, then try meeting some new people. Some good alternative thoughts might be, I'm not in a relationship, but that doesn't mean I'll be alone forever. Or, I'm a bit lonely right now, but I know that some people like me. And finally, being rejected sucks, but I can keep trying until I find the right person for me. Imagine that you are a judge in a court of law. Your job is to look at all the evidence and come to a sensible conclusion. If you find this exercise challenging, ask a trusted friend or relative to help you look at the situation from a different perspective. Write down how you feel when you focus on your new thought. If it doesn't make you feel any better, repeat step 2. There is always a more helpful way of thinking about your situation. In this chapter, we've looked at how cognitive restructuring can help you feel better. In the next chapter, you'll learn about 2 other powerful CBT techniques to lift your mood. To summarize this chapter, depression is a common mental illness. Symptoms include feelings of hopelessness and loss of interest in things you used to enjoy. CBT therapists believe that depression is caused by negative thoughts, negative self-schemas, and faulty thought processes. Automatic negative thoughts, or ANTs, are a common problem in depression, but they can be conquered with the right CBT techniques. Finally, cognitive restructuring exercises help you reframe your negative thoughts and replace them with a more constructive perspective. Chapter 3, Behavioral Activation and Problem Solving. Let's begin Chapter 3. In the last chapter, you learned how your self-schema, thoughts, and view of the world can keep you locked in a state of depression. You practiced 2 CBT techniques therapists often use with depressed patients: sentence completion tasks and cognitive restructuring. In this chapter, you're going to pick up a couple more tools that will help you fight back against low moods and depression: behavioral activation and problem solving. Behavioral activation, or BA. Depressed people often feel weighed down and apathetic. Even small, everyday tasks such as doing the laundry become daunting. Depression drains you of energy, leaving you asking, what's the point in doing anything? As time goes on, you cut more activities from your daily life, which leaves you feeling even more depressed and worthless. Your motivation continues to dive. You start telling yourself things like, I can't cope with anything, or I'll never get better, or I don't enjoy anything anymore. To break out of depression, you need to stop this cycle. The only way to regain control over your life is to deliberately engage in positive activity again, even when you don't want to. This strategy is known as behavioral activation, or BA. The first step is to think of activities you used to enjoy. Let's try an exercise called planning positive activities. Make a list of low-key activities you enjoyed before you developed depression. These activities could be as simple as watching a movie at home. Give yourself time to make your list because depression can make it harder to remember things. Now, plan when you can do 3 of these activities over the coming week. To begin with, 20 minutes is enough. Make a note of each session in your diary. It's just as important as any other commitment, so don't feel guilty about making time for yourself. Don't expect to feel excited at this stage. Making this list probably felt like a chore. That's normal. The real progress comes when you follow through and keep a record. Now for another exercise, a pre- and post-activity mood record. Before you start a planned activity, make a note of your mood. Give yourself a score of 1 to 10, where a score of 1 means very little energy or motivation, and 10 means very excited and enthusiastic. When you've finished, write down your score again. Any increase, even if it's just 1 or 2 points, is a step in the right direction. Sometimes your score might not change at all. If you feel as though nothing is making you feel better, it may even go down. That's okay. It just means you need to change your planned activity, or perhaps try again another time. Choose activities that move you closer to the person you want to be. Behavioral activation is more effective if you choose activities that are in line with your goals and values. For instance, if you want to be more sociable, setting yourself the goal of chatting with an old friend for 10 minutes on the phone would be a great BA goal. Finally, make sure you are choosing activities you really want to do, not what you think you should be doing. For instance, don't set yourself the goal of cleaning the bathroom or doing the grocery shopping. Sure, these are important activities, but the point of BA is to help you re-engage with the things you enjoy. You don't have to look forward to it, just do it anyway. When you try behavioral activation, the little voice in your head might tell you unhelpful things like, "This won't work, you never enjoy anything," or "It can't be this simple, it won't make you feel better," or even, "It might work for other people, but not for you." The secret? Try it anyway. What's the worst that could happen? Even if you try an activity for 10 minutes and feel no different, you haven't lost out on anything. You can then try again the next day, or try another activity. If you feel motivated on some days but not others, you can rest assured that this is completely normal. Progress isn't always linear when it comes to recovering from depression. Some days you'll feel hopeful, others you'll feel defeated before you even start. The trick is to just keep going. When you complete your BA exercises, give yourself plenty of praise. You have every right to be proud. Once you have some evidence that BA works for you, you can challenge these negative thoughts using the cognitive restructuring exercise from the last chapter. Remember, you need to identify an unhelpful thought, look carefully at the evidence for and against it, and then come up with a healthier alternative thought. When to get support? If you've tried BA exercises several times and they don't seem to be working for you, it may be a sign that you need further support from a therapist or doctor. Please don't think that you've failed. Sometimes depression doesn't respond to self-help. If you feel very low or have no energy for even brief 10-minute activities, it's time to find a medical professional who can help you take the first steps to recovery. Depression, problem-solving, and empowering yourself. A little known but very common problem in depression is having trouble making decisions. The good news is that you can sharpen your problem-solving skills. Problem-solving isn't always straightforward, and it can feel overwhelming when your mood is low. At the same time, devising solutions and putting them into practice is very empowering. When you realize that you don't need someone else to come along and rescue you, your self-esteem will grow. This will help you feel good about yourself, which in turn will help lift your mood. 7 steps to problem solving. Here are 7 steps to becoming a better problem solver. Step 1. Work out what the problem is. In some cases, it's obvious. For example, if you need to choose a new school for your child, solving the problem is a matter of evaluating local schools and picking the best option. On the other hand, some problems aren't so easy to pin down. You might know that you are unhappy in a specific situation, but perhaps the details are a bit fuzzy. For instance, if you know that you dislike going into work, you'll need to think carefully about the underlying source of the issue. Upon reflection, you may discover that the problem is, I need to find a new job, or I need to be more organized so that I can have a less stressful time at work. When you've narrowed down the problem, write it in your notebook. You're off to a good start. Step 2. Brainstorm a list of potential solutions. Let your imagination run wild. Put aside half an hour to make a list of every solution you can think of. Don't worry if they seem strange or unlikely. You can also get some outside input by asking a couple of people you trust to help you brainstorm. When you are stuck in a depressed mood, your problem-solving abilities take a hit, so another perspective can be helpful. If you have a serious problem, you could also get advice from a specialist, like a counselor or helpline volunteer. Step 3. Weigh the pros and cons of each solution. You can do this alone or with help. For each potential solution, ask yourself, how much time will it take me? How much money will it cost me? Will I need any outside help, and is it easy to get? Will I need any special equipment or resources, and are there any important long-term consequences to consider? Step 4. Choose the best solution. If you're lucky, you'll have found a perfect solution. Unfortunately, in most cases, we have to compromise. That's why writing out the pros and cons is so important. Knowing that you have given the matter serious thought will make it easier to believe in your own judgment. Remind yourself that no one makes the right choices all the time. Don't fall into the trap of postponing a decision just because you're afraid of getting it wrong. Step 5. Make a plan. Now you need to make a roadmap for the way ahead. Your goal is to draw up a step-by-step plan that leaves you feeling empowered rather than overwhelmed. Make each step as specific as possible. For example, if your goal is to sell your house, a helpful step would be to write, schedule evaluation within the next 7 days, rather than something vague like, find out how much my house is worth. Step 6. Execute your plan. Start with the first step and go from there. Take it slow and steady. You might need to break your steps down even further. No step is too small, as long as it moves you closer to your goal. A few strategies that might help are planning a small reward for every step you take, asking a friend for support, working on a step for just 10 minutes at a time, and keeping a log of your progress so you can see how far you've come. Step 7. Evaluate the results. You've reached the final stage. You've implemented the solution. Did it work? If not, what could you do differently next time? Perhaps something unexpected happened, or you didn't get the information you needed. We can all try our best, but there are lots of things in life that are beyond our control. Even if things didn't quite work out as you hoped, give yourself lots of praise. You tried something new, and that's something to celebrate. Remind yourself that problem solving is a skill. Like all skills, it becomes easier with practice. To summarize this chapter, behavioral activation, or BA, and problem solving are two practical tools many people find helpful in overcoming their depression. BA involves identifying activities you used to enjoy and scheduling time to do them. It's normal to feel resistance when you try BA, but you need to just go ahead and do it anyway. Problem solving reduces feelings of depression because it makes you feel more empowered to overcome whatever challenges life throws at you. Chapter 4, CBT for Insomnia. It's time for Chapter 4. Some people find it impossible to switch off at the end of the day. They toss and turn all night, unable to relax and fall asleep. The next day, they feel cranky and lethargic. Others can get to sleep but then wake up every couple of hours. Does this sound like you? If a lack of sleep is causing you serious health problems, your doctor might prescribe a sleeping aid. However, doctors are reluctant to prescribe them long-term because it's possible to become dependent on them. It's much better to use drug-free therapies instead. Research has shown that around 75% of people with insomnia report much better sleep after undergoing CBT. Specifically, CBT for insomnia, commonly referred to as CBTI, helps you regain control over your sleep schedule. In this chapter, you'll learn how to use CBTI techniques and enjoy more restful nights. The 4 pillars of CBTI. There are 4 steps you'll find in most CBTI programs. Step 1 is to learn about sleep and insomnia. Step 2 is stimulus control and sleep scheduling. Step 3 is to challenge your thoughts about sleep, and Step 4 is to learn how to relax. Let's look at each step in more detail. Step 1 is to learn about sleep and insomnia. You don't need to become a sleep expert, but knowing the basics will help you understand how CBTI works. It will also help you see that losing sleep isn't a disaster, which in turn will reduce your sleep anxiety. When we sleep, we move through two phases: rapid eye movement, or REM sleep, and non-rapid eye movement, or non-REM sleep. Normally, we fall asleep within 15 minutes and enter non-REM sleep. Your heart rate slows, your blood pressure drops, your muscles are relaxed, your breathing and circulation get slower. 45 minutes to an hour after falling asleep, you enter REM sleep. As the name suggests, your eyes make small, rapid movements even though they remain closed. We only dream during REM sleep. During non-REM sleep, your heart rate and blood pressure remain low, but during REM sleep they go up and down. Approximately 30 to 45 minutes later, you move back into non-REM sleep. Throughout the night, you cycle back and forth between the two states. Most people complete 4 to 6 cycles. Not everyone needs the same amount of sleep. You might have heard that everyone needs 8 hours, but this isn't true. Some of us do perfectly fine with 6, while others can't function well unless they get 9, 10, or even 11. You are more likely to wake up during the second half of the night because humans sleep more lightly in the early hours of the morning. If you don't get enough non-REM sleep, which is common in people who wake up throughout the night, you will feel tired and depleted the next day. You can think of non-REM sleep as an overnight charger that helps us stay alert. Sleep quality is more important than sleep quantity. The goal of insomnia treatment is not just to help you get a reasonable amount of sleep, but also to stay asleep long enough to move through normal sleep cycles. Why do some of us develop insomnia? Arthur Spielman's 3PS model. In the 1980s, Dr. Art Spielman proposed that 3 things work together when someone develops insomnia: predisposing factors, precipitating factors, and perpetuating factors. First are predisposing factors. Some people are naturally good sleepers, but not everyone is so lucky. Your genetic makeup and personal traits might be working against you. Having a family history of insomnia, being born with a hypersensitive arousal system, or having a natural tendency to worry all raise your risk of sleep problems. Second are precipitating factors. A bereavement, a redundancy, or even positive stress like planning a wedding can all trigger unhealthy sleep patterns. Can you pinpoint when your symptoms started? Do you think there was a precipitating factor in your case? Third are perpetuating factors. These are habits, behaviors, and thoughts that keep insomnia going. For example, if you lie awake worrying about why you can't sleep, you'll find it hard to drift off. Because you find it hard to get to sleep, you'll start worrying again the next time you get into bed. To break the cycle, you need to change the way you think about sleep and improve your sleep-related behaviors. Your insomnia may have been triggered by a precipitating factor, but you might still struggle to sleep well even when the crisis has passed. This is because insomnia can become a learned response. It takes a conscious effort to relearn the art of sleeping well. Step 2 is stimulus control and sleep scheduling. Now that you have a general understanding of sleep, let's look at the practical steps you can take. Sleep scheduling is a technique that makes sure you are tired at bedtime. It involves recording and changing how much time you spend in bed, when you go to bed, and when you get up. Stimulus control teaches your brain to associate going to bed with falling asleep, making it easier to sleep within 15 minutes of turning in for the night. Together, these 2 techniques increase the number of hours between the time you wake up and the time you go to bed. They also improve your sleep efficiency, which is the amount of time you spend asleep relative to the amount of time you spend in bed. First, you need to start a sleep log. A sleep log doesn't have to be complicated. Just draw up a table that lets you record the date, when you went to bed, when you got up, how many times you woke up, the overall quality of your sleep, how you felt in the morning, what you ate and drank in the 3 hours before bed, whether you took any naps, and any medications you took. Record your sleep for 5 days. Think of this as a fact-finding mission. You can then start to use the tips and techniques that follow. Here's how to schedule your sleep. First, choose a waking up time and stick to it every day. This is the first step in establishing a healthy sleeping pattern. Second, choose a new bedtime based on how much sleep you're actually getting. Look at your sleep log. How many hours do you sleep per night? Add 1 hour and count back from your waking up time. This is your new bedtime. The goal here is to minimize the amount of time you lie awake in bed. Third, limit your naps. Do not nap past 3 p.m. and do not nap for longer than 45 minutes, no matter how tired you feel. Napping later in the day will make it harder to sleep at night. After a few days, your sleep efficiency will improve. When you go to bed, you'll feel tired and ready for sleep. You can then start to increase the amount of time you spend in bed. For example, if you still feel tired when getting 6 hours of sleep, schedule another hour in bed and aim for 7. Remember, we all have different sleep needs. Now let's talk about stimulus control. First, do not use your bed for anything other than sleep and sex. Do not watch TV, read, study, or have any emotional conversations with your partner. Your bedroom should be a peaceful sanctuary. Second, get up within 20 to 30 minutes of waking. This conditions you to see your bed as a place to sleep, not a place to worry or plan the day. Third, go to bed only when you feel drowsy. Learn the difference between fatigue and sleepiness. Fatigue is a general sense of tiredness. Sleepiness is the sensation that you could drift off at any moment. You should go to bed when you feel sleepy, not just tired. Trust your body's signals instead of going by the clock. Fourth, never stay in bed if you can't get to sleep. If you can't fall asleep, or if you wake up in the night and can't doze off again, get up. Do something relaxing, such as a craft or reading a lighthearted book. Stay out of bed for a minimum of half an hour. When you start to feel sleepy, go back to bed. The golden rule is that the longer you lie awake in bed, the harder it will be to get back to sleep. Once you have found a good routine, it won't matter if you occasionally sleep in or have a late night, as long as you get back on track quickly. Here are a few more tips for better sleep. First, fix your diet. Sugar, alcohol, and caffeine are detrimental to sleep. Sugar and caffeine are stimulants and will make it hard to fall asleep. Alcohol is a depressant, but when the effects wear off, your brain and body will become more alert and you may wake up. Second, time your workouts carefully. Exercise is great, but working out in the evening makes it harder to fall asleep. Allow at least 2 hours between exercising and going to bed. Third, fix your environment. It's hard to sleep in a room that's too cold or too warm. The ideal room temperature for sleeping is between 60 and 67 degrees Fahrenheit. Step 3 is to challenge your thoughts about sleep. The next step is to restructure your thoughts about sleep. When you lie awake worrying about having insomnia, your insomnia will only get worse. Cognitive restructuring gets you out of this trap. Here are some destructive thoughts, plus a reality check for each. You might have the thought, I'll never manage to improve my sleeping patterns. But the reality is that CBTI has been effective for many people. It can help you too. Within a few weeks, you'll be sleeping much better. You might think, if I don't get at least 8 hours of sleep every night, my health will suffer. The reality is that while chronic insomnia does increase your risk of some illnesses, you can lower your risk easily by trying the techniques in this chapter. What's more, you may not even need 8 hours of sleep. Anywhere from 6 to 11 hours is normal. Perhaps you think, I'm such a failure, I can't even get to sleep at night. The reality is that insomnia is very common. Lots of people struggle to get enough sleep. Maybe you think, I need drugs to fall asleep. The reality is that most medical professionals don't think drugs are the best way to cure insomnia. CBTI is a safe, well-established method that works for most people. Why not try CBT before going to your doctor? You might be surprised by how well it works. Finally, you might think, unless I get a good night's sleep, I won't be able to function at work. The reality is that while you're more likely to make mistakes after a poor night's sleep, it doesn't mean you won't be able to function. You've probably made it through a day at work before. and you can do it again. Sometimes the stress of worrying about your insomnia can make you feel worse than the insomnia itself. Research shows that people with insomnia underestimate how much sleep they get and overestimate how long it takes to fall asleep. Your case might not be quite as severe as you think. When these beliefs creep up on you, ask yourself, is there any evidence this belief is objectively true? What is the evidence against this belief? Does holding this belief hurt or help me? And what would I say to a friend in this situation? Step 4 is to learn how to relax. If you're having trouble sleeping, you probably have symptoms of stress, anxiety, and depression too. The other chapters in this audiobook are full of practical CBT exercises to help you feel better, which in turn will improve your sleep. A specific type of relaxation exercise, progressive muscle relaxation or PMR, is popular with CBTI therapists. If you practice it regularly, you'll be able to enter a state of relaxation whenever you like. This is helpful when you want to relax before bed or if you want to get back to sleep in the middle of the night. Let's try an exercise in progressive muscle relaxation. First, lie down in bed and close your eyes. Second, breathe in. As you inhale, scrunch your toes. Squeeze the muscles as hard as you can. Hold this position for a few seconds. Third, exhale and relax your muscles. Fourth, inhale and tense the muscles in your calves. Hold for a few seconds, then release and exhale. Fifth, continue this pattern of inhaling and tensing, then exhaling and releasing with all your major muscle groups. Finish with your facial muscles. Sixth, repeat the exercise if you'd like. For best results, do it every day. Worry. Everything seems worse at night. Lying in bed worrying is miserable and counterproductive. It certainly won't help you sleep. Worry time can help limit your worries. Pick a 20 to 30 minute time slot each day. During that time, let yourself feel as anxious or as worried as you like. If you start worrying at other times of the day or in bed, tell yourself, I'll save that for my worry time. A quick word of caution. If you have a sleep disorder or another illness, CBTI might not be right for you. It's best to check with your doctor before trying self-help methods for insomnia. For example, if you have restless leg syndrome or another condition that causes your body to move in uncontrolled ways, you might need medication or physical therapy along with CBTI. Finally, remember that CBTI will take time to work. You should expect that it will take at least 6 weeks to overcome your sleep problems. To summarize this chapter, insomnia is a common problem. CBTI is a special form of CBT designed to improve sleep patterns. CBTI entails learning about sleep, stimulus control, and sleep scheduling, cognitive restructuring, and learning to relax. CBTI can take a few weeks to work and requires patience. If you suspect you have a serious sleep disorder or have an illness that affects your sleep, consult a doctor before trying the strategies in this chapter. If you're finding the techniques in this audiobook helpful for taking control of your thoughts and improving your sleep, you might be interested in supporting the author. You can do this by trying a free 30-day Audible trial or by purchasing the book via the Amazon link in the description. As an Amazon associate, we earn from qualifying purchases. Your support helps create more resources like this to help people improve their mental well-being. Now, let's continue with the next chapter. CBT for anxiety. We now begin Chapter 5. Everyone experiences anxiety from time to time. We all know what it's like to feel uneasy or to dread something. Anxiety can be mild, moderate, or severe. Anxiety can be unpleasant, but it's healthy in small doses. If our ancestors never felt anxious about getting enough food or other issues of survival, we wouldn't be here today. Anxiety motivates us to act. Unfortunately, excessive anxiety can make life difficult. If your anxiety has taken over your life, it's time to make some changes. In this chapter, you'll learn about the most common types of anxiety and how CBT can help tame your worries. Not all anxiety is the same. Anxiety comes in many forms. First, there is panic disorder, which is a condition characterized by multiple recurrent panic attacks. A panic attack usually starts suddenly and lasts for around 5 to 20 minutes. Symptoms include sweating, ringing in the ears, trembling, dizziness, nausea, shortness of breath, a choking sensation, palpitations, and tingling fingers. You might also have disturbing, racing thoughts. Panic attacks happen when your body releases stress hormones, including adrenaline, which stimulates your nervous system. Then there are phobias, which are an irrational or extreme fear of a situation, object, or animal. When someone with a phobia encounters the thing they fear, they may have a panic attack. Next is agoraphobia, which is an extreme fear of being stuck in a situation where it would be difficult to escape. An agoraphobic person might be scared of leaving their home, traveling on public transport, or visiting crowded places. There's also generalized anxiety disorder, or GAD. This is a condition in which someone worries about a wide range of events and situations. They feel worried most of the time and find it hard to relax. Even if one of their worries is resolved, they quickly move on to worry about something else. Finally, there is social anxiety disorder, or SAD. This is a fear of social situations. Someone with SAD will worry or panic about going to parties, going to work, meeting new people, and making small talk. If you have SAD, you probably spend a lot of time worrying about what others will think of you. These conditions can look different, but they are all centered around feelings of anxiety. The exercises in this chapter can be helpful for anyone who has an anxiety disorder. Remember, you can't diagnose yourself with a mental illness. It's best to see a doctor or therapist who can make a proper assessment. Let's do an exercise. Working on anxiety is scary. You will need to move beyond your comfort zone and embrace the things that frighten you. To keep yourself motivated, take a moment to write down how anxiety limits your life and why you want to get better. How will things look when you are no longer afraid? Using cognitive restructuring skills to overcome anxiety. To gain control over your fears, you need to work on overcoming beliefs that fuel your anxiety and beliefs about anxiety itself. Cognitive restructuring works well for people with anxiety. We already covered how it works in earlier chapters, but here's a quick refresher. Cognitive restructuring consists of 3 steps: identifying your negative thoughts, weighing up the evidence for and against each thought, and then replacing unhelpful thoughts with a more constructive perspective. Asking thoughtful questions helps you take a rational approach. When challenging a thought, ask yourself, what would I say to someone else in this situation? If I didn't feel anxious, how would I look at the situation? How would someone who isn't anxious look at the situation? And is there any objective evidence that my thought is true? Let's try another sentence completion exercise to uncover your beliefs about anxiety. Complete these sentences. If I worry all the time, If I didn't worry, I would. When I realize how much time I spend worrying, I think worrying makes me feel. I first started having anxiety problems when you completed the exercise, did any of these beliefs come up? First, if I worry all the time, I'll keep myself safe. It's true that remaining vigilant can help you identify dangerous situations early, but worrying can't protect you from everything that could go wrong. Most of the time, worrying is a waste of your energy. Second, if I worry about the worst-case scenario, I won't be so upset when it happens. Worry cannot protect you from loss or disappointment, and it can't keep bad things from happening. Third, it's bad for me to worry so much. Worry can't make you go mad. Neither can you die from it. Sure, anxiety can be scary, but it won't kill you. Fourth, I'm a born worrier. I'll never be able to get over my anxiety. Some of us do tend to worry more than others, but we can all choose to face our fears and fix our thinking errors. There's a good reason CBT is so popular for anxious clients. Anxiety and logical errors. You already know that thinking errors can make depression worse. The same applies to anxiety. Go back to the chapter on CBT and depression. In that chapter, we looked at how logical errors keep depression going. Which of these errors do you think fuels your anxiety? Why? Can you give specific examples? Here are a few examples of the logical errors often seen in anxiety disorders. First is mind reading. For example, Andy has social anxiety disorder. He assumes that he just knows what other people are thinking. When he has to sit next to someone he doesn't know at his sister's wedding, he tells himself that they think he's boring and stupid. Second is catastrophizing. For example, Maria gets very anxious about making mistakes at work. She turns in a project and then worries that her boss will think it's no good. Her boss sends her an email asking for a few minor adjustments. Maria's mind goes into overdrive. She assumes that her boss thinks she is incompetent and that it's only a matter of time before she gets fired. Third is overgeneralizing. For example, Tom has to give a speech at work. It goes okay, but it could have gone better. He missed a couple of slides and spoke too quietly. Instead of thinking about how he could do better next time, Tom tells himself, "I'm terrible at public speaking. I always mess up my presentations." Fourth is labeling. For example, Sally has a fear of dogs. One day she is taking a walk through the local park. She sees a large dog knock over a small child. Although the child is unhurt, Sally immediately decides that the park is dangerous. This makes her more likely to avoid the park in the future. Challenging your thoughts is the first step to recovery. Next, you need to follow it up with action. Breaking the avoidance anxiety cycle. If something makes you feel afraid, your natural impulse is to remove yourself from the situation. Unfortunately, changing your behavior so you don't have to face the things that make you anxious can backfire. This is known as avoidance. For example, if you develop a fear of public transport, you may start walking to work instead of taking the bus. This kind of behavior works in the short term. However, if you get into the habit of avoiding situations that make you anxious, you'll never get the chance to see that everything can work out okay. Instead, you'll become trapped in a cycle. First, you avoid the thing that's making you feel scared. By doing this, you are teaching yourself that whatever you are avoiding really is something you should be afraid of. So you keep avoiding it. You never get the chance to learn that it isn't so scary after all. You may also start to fear similar situations. Your life becomes increasingly limited, and your confidence starts to shrink. To get past your anxiety, you need to confront your fears and learn that you can come out well on the other side. This is called exposure therapy. Facing your fears using exposure therapy. In brief, exposure therapy works like this. First, you pin down what exactly is making you anxious. Second, you make a list of specific situations that make you feel anxious or afraid. Third, you put these situations in a hierarchy, starting with the least scary situation. Fourth, you schedule your exposure, then follow through. Finally, you expose yourself to whatever makes you feel anxious until you learn that you can survive the fear. Exposure therapy is simple but difficult. It's easy to see how it works in principle, but putting it into practice requires courage. If you are ready to give it a try, start with this exercise, putting your fear into words. In a single sentence, summarize the main source of your fears. For example, I am afraid of speaking to people I don't know, or I am afraid of cats. This exercise gives you a starting point for your therapy. Having figured out your root fear, you can start to put together a plan of action. The next exercise is to make a fear ladder. Following the steps above, make your own fear ladder. Try to think of 5 to 10 situations. Be precise. For example, if you are afraid of elevators, are you scared of elevators in department stores, office buildings, or other settings? Here's an example of what a fear ladder might look like for someone with social anxiety. The first item causes the least distress, while the 10th is the scariest. Number 1, saying good morning to a colleague. Number 2, asking a colleague if they had a good weekend. Number 3, asking a shop assistant for help. Number 4, making small talk with a cashier. Number 5, making a phone call to an old friend. Number 6, eating lunch with a colleague. Number 7, inviting 2 people out for drinks. Number 8, holding a small dinner party with 4 people. Number 9, joining a new hobby group alone. Number 10, giving a presentation at work. Everyone's fear ladder will be different. This is just an example. Scheduling exposure. Don't let yourself procrastinate. The sooner you start, the better. Start by scheduling your first exposure session in your diary. Treat it with the same respect as any other appointment. If you tend to procrastinate, ask a friend to hold you accountable. When you are facing your fear, here are a few things to keep in mind. First, be patient. Don't try to skip ahead. Only move up your anxiety ladder when you have conquered the step before it. Be prepared to repeat each step around 5 to 7 times. Second, give yourself enough time to wait for your anxiety to subside. The human body can't remain in a state of panic forever. Panic attacks usually last around 20 to 30 minutes, then subside. Even if you feel panicked for a long time, your attacks won't hurt you. Third, do not use safety behaviors or distractions while waiting for your anxiety levels to drop. Talking to someone, repeating mantras, or holding a safety object are all distractions from the task at hand, facing your fear. Let's try an exercise called monitoring anxiety levels. Every time you expose yourself to a situation that makes you anxious, give yourself an anxiety score before and after each attempt. For instance, you may give yourself a score of 9 before and a 5 afterward. Your goal is to lower your anxiety to a score of 0 to 2. It's okay if this takes longer than you might like. Fourth, reward yourself. Every step up your fear hierarchy is a cause for celebration. Give yourself frequent rewards and praise yourself. You are doing great. Handling panic attacks. Panic attacks are the main symptom of panic disorder, but anyone can have them. The good news is that when you understand what's going on in your body and mind when you panic, you'll be well equipped to deal with them. When you notice the symptoms of an attack, your thoughts might go into overdrive. For example, when your heart speeds up, you might start thinking, "My heart is about to explode." Your symptoms are caused by your body's natural fear response. During an attack, your body releases hormones like adrenaline. It's an automatic reaction, honed by evolution. It's out of your conscious control. However, you do have a choice when it comes to interpreting your symptoms. You can choose to think that your heart palpitations mean you are having a heart attack, but you can also choose to challenge this thought. You can choose to tell yourself, "This feels awful, but I am not having a heart attack. It's the adrenaline that makes me feel this way. It will be over soon." Your thoughts can make the difference between an unpleasant panic attack and one that seems to go on forever. It all comes down to how you think about it. Panic attacks are also linked to avoidance and safety behaviors. For example, you go to a crowded shopping mall. You think, "I might never find my way out if there's a fire." You start to worry. Your body responds by releasing adrenaline, causing symptoms of panic. You notice your heart beating fast. You think, "I'm having a heart attack." You leave the mall as soon as possible, feeling terrified, and vow never to go back. The solution is to notice that you are having an attack. Practice thinking helpful thoughts and give yourself the chance to see that the situation isn't so bad after all. That means not fleeing, but instead waiting until the symptoms subside. This is a form of exposure therapy. You need to stick it out and prove that panic attacks aren't the end of the world. Here are a few typical thought traps paired with more realistic, balanced thoughts. You might think, "I can't cope with this." An alternative thought is, "I've had panic attacks before and things turned out all right." You might think, "I'm dying." An alternative is, "This attack won't kill me. It's my body's natural fear responses that are making me feel this way." You might think, "I've got to get out of this situation right now." An alternative is, "I am safe. I need to stay in this situation to prove that things are all right." You might think, "I'll never stop having panic attacks. They are ruining my life." An alternative is, "Lots of people overcome their panic attacks. I can too." Finally, you might think, "I'll never be able to cope with this unless I get some medication." An alternative is, "Drugs can only ever be a quick fix. I can learn to cope with these attacks by myself." Symptom provocation. Proving you can cope with worrying sensations. Symptom provocation is another form of exposure therapy. It involves deliberately triggering the same symptoms you get when you're having a panic attack, so you can see for yourself that they are harmless. It's also known as interoceptive exposure. The most popular exercise is deliberate hyperventilation. When you hyperventilate, you breathe more quickly than usual. The levels of oxygen in your bloodstream go up, which triggers symptoms like lightheadedness and tingling. If you want to try this, find somewhere quiet and private. Sit down in a comfortable chair. Take a few deep breaths. Gradually speed up your breathing until you start to experience the same symptoms you get during a panic attack. Observe your symptoms for a couple of minutes. Watch as they subside. Practice this a few times per week, and the thought of having a panic attack will no longer seem quite so terrifying. If you don't want to try inducing hyperventilation, you can try spinning around on a desk chair for a few minutes to induce feelings of dizziness. To replicate a pounding heart, you could run up and down the stairs a few times. A quick word of caution. You can try symptom provocation by yourself, but if you start experiencing any physical sensations that are new or particularly worrisome, stop. It may be best to work through these exercises with a trained therapist. What about relapses? Lots of people have a few lapses when they've finished treatment for anxiety. It's totally normal. You're more likely to have a relapse if you've been feeling tired or stressed. The answer? First, take good care of yourself. Eat a good diet, schedule time for relaxation, and talk to someone you trust when life feels overwhelming. Second, start using your favorite CBT exercises again. If you've used CBT to feel better before, you can do it again. It worked for you in the past, and it will work again this time around. To summarize this chapter, anxiety comes in many forms, including panic disorder and agoraphobia. Avoidance behaviors and beliefs about anxiety can keep you trapped in anxiety cycles. Challenging these beliefs is the first step. Exposure therapy is a structured framework for conquering your fears by confronting them until your anxiety peaks and subsides. You can deal with panic attacks by accepting the symptoms and changing how you think about them. Symptom provocation lets you see that panic attack symptoms won't hurt you. Relapse is common, but you can always use your CBT skills whenever you need them. Using CBT to beat OCD and intrusive thoughts. Let's begin Chapter 6. At least 2% of the population suffers from obsessive-compulsive disorder, commonly abbreviated to OCD. As the name implies, people with the disorder have obsessions and compulsive behaviors. It occurs in both sexes and all age groups. Obsessions are unwanted, unpleasant thoughts that can be very scary. They might be words, images, or urges that seem to pop up randomly or in response to particular situations. Common obsessions include a fear of germs, a fear of saying something obscene in public, and intrusive violent images. Compulsions are repetitive mental acts, like counting to 100, or behaviors carried out to relieve the feelings triggered by the obsessive thought. For instance, if you have OCD and your obsession relates to germs, your response might be to wash your hands several times. What causes OCD? Like most mental illnesses, OCD is caused by a mix of genetic and environmental factors. If you have a close relative with OCD, you are more likely to develop it yourself. Research has shown that brain chemistry could play a role. For instance, people with OCD typically have low levels of the neurotransmitter serotonin in their brains. Sometimes OCD symptoms start after a major life event such as a bereavement or job loss. Personality is also a factor. If you've always been a perfectionist, you are more vulnerable to OCD. The OCD cycle has 4 parts. First is the trigger. An unwanted, distressing, and intrusive thought, urge, or image enters your mind. Second is anxiety. The thought, urge, or image triggers feelings of anxiety. Third is the compulsion. You feel compelled to carry out some kind of behavior or mental act to counteract your anxiety. Fourth is temporary relief. Your compulsive behavior helps you feel better, but soon the anxiety comes back and the cycle starts again. You don't have to experience both obsessions and compulsions to have OCD, but most people with the condition get stuck in this kind of cycle. Let's do an exercise to understand your cycle. Make a list of your obsessions, anxieties, and compulsive behaviors. How do they relate to one another? You could even draw a diagram showing how your personal OCD cycle works. Here are a few of the most common obsessions. First, an extreme fear of catching a disease or becoming contaminated in some way. During a global pandemic, of course, this fear is justified. Second, worrying that you will accidentally cause harm or damage to yourself or others, for example, by failing to make sure that all the windows are locked. Third, worrying about deliberately hurting yourself, strangers, or those you love. For example, you may have intrusive thoughts about stabbing your partner. Fourth, a strong urge to tidy up objects, order them in a particular way, or arrange them symmetrically. Finally, worrying that you find certain people sexually attractive. Some people become obsessed with their sexual orientation and have intrusive thoughts about themselves with someone of the same sex. It can be hard to examine your thoughts. You might feel ashamed, crazy, or dangerous. In fact, it's extremely rare for someone with OCD to act on their obsessions. Obsessions trigger compulsions, such as checking doors and windows multiple times or checking that electrical appliances are switched off. You might repeat words or mantras, count things, or order things. Cleaning the body or objects is another common compulsion. Some people deliberately think good thoughts to cancel out the intrusive thoughts. Others ask for reassurance from others or go to extreme lengths to avoid triggering situations. OCD doesn't normally get better by itself. You need to tackle the thoughts and behaviors, breaking the cycle so that they no longer have such a hold on your life. Intrusive thoughts are normal. It's your reaction that makes the difference. Most people have unpleasant, intrusive thoughts from time to time. Think back to what life was like before your symptoms started. You probably had strange, unwanted thoughts occasionally. The difference? Back then, you didn't pay them much attention. Let's try an exercise. You'll need a trusted friend or relative for this one. Tell them that you've been learning about OCD and that most people have intrusive thoughts. Ask them if they've ever had weird, crazy, random thoughts that took them by surprise. They will almost certainly say yes. Knowing that wacky thoughts are normal can be reassuring. Telling yourself not to have intrusive thoughts does not work. The more you tell yourself not to think about something, the more you'll think about it. You can't treat OCD by willing it away. Instead, you need to interrupt your responses to the thoughts and learn to tolerate anxiety. Why reassurance seeking doesn't work. When an intrusive thought pops up, it's natural to ask family and friends for reassurance. For example, if you have intrusive thoughts about harming your spouse, you might ask them, "Do you think I'm a violent person?" Of course, your family and friends will reassure you. What's the problem with this? It doesn't work. It might make you feel better for a few minutes, but the thoughts will come back. If reassurance worked, people with OCD would be able to cure themselves on the spot. To make matters worse, asking the same questions over and over again can put a strain on the relationship. Research is another form of reassurance seeking. For instance, if you have obsessive thoughts that you will cheat on your partner and spend hours online searching for signs that someone will have an affair, you are trying to reassure yourself. It won't make you feel better. In fact, you'll probably fall down an internet rabbit hole and end up feeling worse. You need to break the reassurance habit. Tell your loved ones that it's important you stop asking them to reassure you. If you ask them anyway, they need to say something like, "We agreed that I won't reassure you. Let's talk about something else." If you use the internet for reassurance, you could block any websites you keep returning to, use an app to limit your internet usage, reward yourself for each day you manage to go without looking for reassurance online, or ask a friend to remind you to stay away. Why you need to avoid avoidance. Avoiding your triggers might work in the short term, but it isn't a cure. As you saw in the last chapter, avoidance isn't a good strategy for treating an anxiety disorder. It limits your life, makes you feel helpless, and fuels your worries. For example, if someone feels anxious when they use a public bathroom because they fear contamination, they will try to avoid public bathrooms at all costs. The link between intrusive thoughts and compulsive behavior becomes stronger. Every time they avoid public bathrooms, this link gets stronger. The only way to break the chain is to keep yourself from responding to compulsive thoughts and learning to tolerate anxiety. Exposure and response prevention, or ERP, is a popular CBT technique that teaches you to do just that. Exposure and response prevention. In ERP, you allow your obsessive thoughts to surface and then face them without using compulsive behaviors. For instance, if you feel compelled to wash your hands 3 times after touching a doorknob, you would deliberately touch a doorknob, but then abstain from washing your hands. At first, ERP will be extremely difficult. It takes time to train yourself to avoid engaging in compulsive behavior whenever your anxiety is triggered. ERP requires a high level of commitment. You need to make a conscious choice before your anxiety is triggered that you won't follow your urges. The good news is that ERP works fast. When you keep yourself from responding, you'll feel extremely anxious, but your anxiety will start to drop within 20 minutes. When you repeat this sequence several times, you'll start to become habituated. The anxiety will become more bearable, and your urge to carry out your old compulsions will start to fade. ERP can even become enjoyable because with every exposure, you are triumphing over your old anxieties. Getting started with ERP. You can use ERP as part of a self-help program, but you'll need to be well prepared. If you expose yourself to your most feared situations too quickly, you may become overwhelmed and give up. You need to identify your triggers, then gradually work your way through the list. Here's an exercise. What are your triggers? Draw up a list of triggers. These are everyday situations that cause your obsessive thoughts to pop up. For instance, if you are afraid that you will harm an animal, seeing a dog might be a trigger. Rank your triggers in order, from the least to most scary. This will be the basis of your ERP ladder. You can now start working your way up the ladder. If you have multiple obsessive fears, make a ladder for each one. Now start scheduling your ERP sessions. You may need to expose yourself to a trigger several times before you can move past your fear. That's normal. Resisting subtle avoidance. Regular avoidance is easy to spot, like avoiding public bathrooms. However, not all avoidance is so obvious. Some people use other behaviors to manage their anxiety. For example, they might be able to do something that scares them, but only if they can talk to someone else while they do it. Other forms of subtle avoidance include holding a comforting object and deliberately thinking about other things. Be firm with yourself. Treat subtle avoidance just as you would more overt behaviors. Resisting urges. If resisting an urge is causing you extreme anxiety, try reducing or delaying your compulsive behavior. For example, if you usually feel compelled to say a prayer whenever a bad thought comes into your head, try to wait 2 minutes first. Next time, delay it by 5 minutes. Gradually increase the time until you learn that you can tolerate your anxiety and that nothing bad will happen if you don't give in to your compulsions. Modeling. If you have been dealing with obsessions and compulsions for a long time, you may have forgotten what normal behavior looks like. Ask a friend to show you how to do an everyday task that makes you anxious. For example, if you feel an overwhelming compulsion to wash your hands multiple times after cleaning the bathroom, watch your friend clean and then wash their hands only once. Make sure you pick someone you trust. Imaginal exposure. If the thought of exposing yourself to your trigger situations is too overwhelming, you can use imaginal exposure, or IE, first. IE involves imagining yourself in a situation that triggers your anxiety. By visualizing the scene and observing your anxiety come and go without using your compulsive behaviors, you can prepare yourself for full ERP. For example, let's suppose you have an obsession with cleanliness, and you can't get to the next step on your ERP ladder, which involves touching a door handle in a public bathroom. Instead of actually exposing yourself to the situation, you would sit quietly and visualize it. You would imagine how it would feel to touch the handle, and then observe any worrying thoughts and anxieties that pop up. You would then carry on visualizing the scenario until your anxiety subsides. It's important to note that using IE like this should be a warm-up to ERP, not a substitute. Keep an eye on your stress levels. OCD tends to flare up when someone is under stress. If you have a big life event coming up, make sure you have healthy coping mechanisms in place. Otherwise, you might find yourself slipping back into old obsessive patterns. Simple self-care, such as getting enough sleep and spending enough time with friends and family, is important. To summarize this chapter, OCD is an anxiety disorder. Sufferers get stuck in a cycle of obsession, anxiety, and compulsion. OCD does not get better on its own. You need to expose yourself to your triggers and practice resisting your urges. Exposure and response prevention, or ERP, is a technique that teaches you to resist your usual compulsive behaviors. Resisting urges is a key skill that is difficult to master, but you can use a gradual approach if needed. Keeping your stress levels under control will help protect you from relapse. Chapter 7, Using CBT to Beat Procrastination. Let's begin Chapter 7. CBT is a great approach to treating mental illness, but it has many other applications. In this chapter, we're going to look at how you can use CBT techniques to overcome a common problem that holds many people back: procrastination. What is procrastination? Procrastination is choosing to delay or not complete a task for no good reason, even though doing so will have negative consequences. Usually, procrastination involves doing something else that isn't as important, just to fill in the time or provide a distraction. You can think of procrastination as a bad habit that might affect several areas of your life, or you might only procrastinate in some situations. For example, you might be organized at work, yet procrastinate on DIY projects at home. Why is procrastination such a big deal? Everyone procrastinates sometimes. It's human nature. Our brains have evolved to seek pleasure and avoid pain. Unpleasant tasks are psychologically uncomfortable, so our first instinct is to avoid them if possible. For 20% of the adult population, procrastination is a chronic problem. Unfortunately, ignoring a task doesn't make it go away. Although distracting yourself works well in the short term, you'll still have to face reality at some point. To make matters worse, delaying a task makes it more stressful when you do finally get started. It's common for a procrastinator to beat themselves up and get locked into a spiral. It looks something like this. The procrastinator delays a task, which makes them less stressed in the short term. As the deadline looms, they realize they have less time, which makes them feel even more daunted. To make themselves feel calmer, they decide to delay the task yet again. But they know the job needs to get done, so they seek further distractions, and the cycle begins again. There's another dark side to procrastination. It damages your self-esteem. When you decide to do something but fail to follow through, you are sending a clear message to yourself: I can't be trusted. Finally, procrastination can have serious consequences for your relationships. If you keep reassuring a loved one that you will get around to doing something, but then never do it, they will start to resent you. Let's try an exercise. Make a list of all those tasks you've been delaying. Why do you think you've been procrastinating? How long have you been putting them off? How has your procrastination affected your work and your personal life? Are you making excuses? Even if you don't think of yourself as a creative person, there's a good chance you are very accomplished at coming up with excuses for your procrastination. Do any of the following sound familiar? I work better under pressure anyway. I'm too tired to do anything now. I'll start tomorrow. I need to feel inspired before I can do anything. I'm not going to do very well on this project anyway, so why bother? Life's too short to work all the time. I deserve to enjoy myself. These excuses are based on assumptions, such as, I shouldn't have to do anything I don't like, or, it doesn't matter how hard I try, I'll get it wrong anyway, and I need to wait until I want to do a task before starting it. Excuses make you feel better about procrastinating, but they don't change the facts. Some of these excuses have a grain of truth, which makes them very compelling. For instance, it may be true that you feel tired, but this doesn't change the fact that you need to start the task anyway. Here's an exercise to challenge your excuses and assumptions. What was the last excuse you used? Ask yourself these questions. What is the evidence that this excuse is valid? What assumptions am I making? What is the evidence that it would be better for me to start anyway? How would I feel if I started the task anyway? How would I feel if I delayed it even further? And what would I say to a friend in this situation? Having answered these questions, what do you think your next course of action should be? Tolerating discomfort. Learning to tolerate discomfort and boredom is essential. When you can keep going with a task, even when you'd rather be doing almost anything else, you'll become an unstoppable productivity machine. Many of us believe that boredom is unacceptable. We live in a world where entertainment is always available, but the harsh truth is that life is a mix of pleasure and pain. You need to let go of the assumption that life should always be comfortable. Here's an exercise for noticing discomfort. The next time you want to abandon a task, take a deep breath and sit or stand still instead. Tune into your body. How do you feel? Do your muscles feel tense? How is your posture? Are you prepared to keep working anyway? Acknowledge your feelings and then continue with your task. This is a powerful exercise because it challenges your assumption that it's best to give up whenever you feel like walking away. You'll soon realize that discomfort is actually normal and bearable. Paradoxically, the better you are at accepting discomfort, the easier your work will be. Getting through a dull task can bring a sense of achievement. It might not be fun, but it's definitely satisfying. You don't have to pretend that a dull task is enjoyable, but you can take a moment to savor the satisfaction you'll get when it's complete. Getting over your fear of failure. Do you procrastinate because you have an underlying fear of failure? You're not alone. For many procrastinators, missing a deadline can feel safer than turning an assignment in and receiving criticism. To overcome this problem, you need to address your thoughts and feelings about failure. Let's look at a few destructive beliefs you might have about failure and how to replace them with healthier thoughts. First, you might believe, if I don't get it right, I'll never succeed. Think about a baby learning to walk. No one is born with these skills. They must be learned through trial and error. You won't get everything right the first time, but this doesn't mean you will always get it wrong. Second, you might believe, I can't cope with negative feedback. Criticism can feel like the end of the world. However, when you are in a balanced frame of mind, it's just part of life. Perhaps you have been on the receiving end of harsh criticism before, but you're still here. That's proof that you can survive it. It's also worth remembering that not all feedback is constructive. Third, you might believe, if I fail a test, it means I'm a total failure. Failing in the past doesn't mean you are bound to fail in the future. Failure can be a great teacher. You can learn from your mistakes and do better next time. Here's an exercise about who fails. It's in 2 parts. First, think of a famous person who inspires you. Do a bit of online research. You'll almost certainly discover that they have failed at a few things. Next, ask a trusted friend or family member if they've ever had a big setback they had to overcome. Again, you'll almost certainly learn that they've had to deal with failure. Waiting for inspiration. Many procrastinators assume that if they don't feel inspired, they shouldn't start a task. This is a dangerous assumption. You can't afford to wait around for inspiration or motivation to strike. Inspiration is fickle. To be really successful, you need to work regardless of your mood. If you wait to feel inspired before beginning, especially if the task is dull, you could be waiting forever. The same applies to feeling tired. Yes, it's harder to begin a job if you're fatigued, but that doesn't mean you can't or shouldn't start anyway. Getting over uncertainty. Another unhelpful assumption is that you have to know precisely what you are doing before you get started. Yes, you need a sensible plan, but many tasks are open-ended. It's impossible to predict exactly what you'll need to do at every stage. It's best to put together a plan, but remain flexible. If you hit a roadblock, you can draw on the problem-solving skills you learned earlier. Try to reframe difficulties as a learning experience. More practical tips for beating procrastination. Here are some more practical tips. First, do the worst first. Is there a task you're dreading? Get it out of the way, and you will find it easier to face the rest of the day. Second, prioritize your tasks. Spend a few minutes grading the items on your to-do list. For each task, ask yourself whether it is important, urgent, or both. Work through your tasks in this order: urgent and important, then urgent and unimportant, then non-urgent and important, and finally non-urgent and unimportant. Third, break tasks down into small chunks. Take big projects step by step. Write down your final deadline, then break down the small tasks you need to accomplish between now and then. Keep breaking them down until you no longer feel overwhelmed. Fourth, build momentum. Can't find the energy to start a task? Do something you like for a few minutes, then dive into the task. The momentum can give you a jump start. Fifth, keep a time log. Scheduling is much easier if you can confidently predict how long a task will take. Start keeping notes detailing how many minutes or hours you need for each task. Sixth, set a timer and challenge yourself to work for 5 minutes. 5 minutes is barely any time at all. you'll probably find that it isn't too hard to keep going when the timer goes off. Seventh, use rewards. You deserve a reward for getting your tasks done. It doesn't have to be expensive. A magazine, a movie, or a long bath are all good choices. Eighth, make it easy to pick up a task again. If you need to work on a task over several days, finish each session by setting yourself up for success when you pick it up again. For example, if you are writing a report, leave a couple of sentences half-finished. Ninth, get an accountability buddy. Tell a friend or colleague what you plan to achieve and when. Ask them to check in on you. You could even place a bet. For instance, you could bet your friend that you will have done a task by a certain day, or you'll buy them lunch. Here's one last exercise. There are lots of practical tips in this chapter, but you'll get overwhelmed if you try to implement them all at once. Start by choosing 3 strategies you like and trying them out over the coming week. If they work for you, that's great. If they don't, stay open-minded and try something else. To summarize this chapter, procrastination is the act of putting off a task for no good reason. It has serious consequences for your work and relationships. Procrastinators make a lot of excuses for their behavior. You need to identify these excuses and challenge the underlying assumptions. Practical solutions include prioritization, doing the worst tasks first, and challenging yourself to work for a few minutes at a time. Learning to tolerate discomfort will improve your stamina and help you get boring jobs done. Chapter 8, Releasing Regret and Getting Over Guilt Using CBT. It's time for Chapter 8. Do you ruminate about the mistakes you've made? Do you want to feel more comfortable with your past choices? In this chapter, we're going to look at how CBT can help you move past feelings of guilt. If you leave them unchecked, your regrets will hold you back from reaching your full potential. It's time to reframe your past, learn from your mistakes, and work toward a brighter future. How do you feel about guilt? Everyone makes mistakes. We all have our faults. Even the kindest and most moral of us have made poor choices. Unfortunately, hurting other people is part of being human. CBT gives you the tools to understand where guilt and regret come from, how to move past them, and how to avoid making bad choices in the future. Remember, how you react to events, including your mistakes, is just as important as the event itself. You are not responsible for everything. If you are prone to guilt and regret, you probably have a habit of assuming too much responsibility. When you are too quick to say, "Yes, this situation is entirely my fault," your view becomes warped. In reality, most unfortunate events aren't caused by one person. For example, let's say that your relationship has recently broken down. You and your partner have fallen into a pattern of getting into trivial fights that turn into screaming matches. To make matters worse, you disagree on other issues, including marriage. You want to marry, and they don't. So who is at fault in this story? If it happened to a friend, you would probably reassure them that there are many factors at play. You might tell them, sometimes relationships just don't work out. Or it sounds like you wanted different things. Or neither of you are bad people, you're just incompatible. You would hopefully not say things like, "This is all your fault." The strange and sad thing is that most of us have no trouble being kind and compassionate to our friends, but we are very harsh on ourselves. We often pile blame on ourselves whenever things go wrong in our own lives. This leads to guilt, regret, and a sense of hopelessness. Slicing the responsibility pie. The following exercise will help you step back from a situation and understand the part you played in it. It's called the responsibility pie. First, make a list of everyone who played a role in the event you're feeling bad about. Now, draw a large circle on a piece of paper. This is your responsibility pie. Draw lines to divide this pie up into slices, one for everyone on your list. Make the size of the pieces proportionate to their responsibility. Go with your gut instinct. Look at the pie and remind yourself that most life events have multiple causes. Yes, perhaps you should have made a different choice, but it's unlikely that the blame rests with you alone. Yes, but what if it really was my fault? Of course, you might have made a big mistake, and no one else is to blame. For instance, let's say you go to a conference, get drunk, and cheat on your partner. Your partner finds out, and they end the relationship. In this case, your partner isn't to blame. However, even when you have done something most people would consider wrong, it doesn't mean you need to feel guilty forever. Many of us have beliefs about guilt that are untrue and unhelpful. By identifying and challenging them, you can put your guilt in its proper place, process it, and then move on. Here's an exercise to explore your beliefs about guilt. Complete the sentences below. If I didn't feel guilty, I would. I don't think I can give up my feelings of guilt because. Guilt is useful because. What do you think your answers reveal about your beliefs? Common beliefs about guilt and why they are so destructive. Let's look at some common beliefs about guilt. First, if I feel guilty, I must have something to feel guilty about. This is simply untrue. For instance, some people feel guilty when they survive an accident in which others died. This kind of survivor guilt is clearly irrational. It's an example of emotional reasoning. Just because you think you are a bad person doesn't mean you have anything to feel bad about. Second, if I feel guilty, it means I am a bad person. Even if most people would agree that your guilt is justified, you are not a bad person. This line of thinking is an example of generalization, a cognitive distortion. Just like everyone else, you are a complex individual who has done great things but also made mistakes. Third, guilt will stop me from hurting people in the future. Don't fall into the trap of assuming that guilt somehow protects you from repeating your mistakes. This approach is doomed to fail because it undermines your self-confidence. Your morals and values are better at helping you make good choices, not guilt. Guilt also damages your relationships. It makes you negative and afraid. Finally, guilt sucks up your energy. You end up wasting time beating yourself up instead of making positive changes. Fourth, I need to feel guilty forever because I need to punish myself for what I've done. In small doses, guilt is healthy. It's a warning signal that you've violated your own moral code. However, feeling guilty for a long time doesn't benefit anyone. You cannot go back in time and change the past. Guilt becomes self-indulgent after a while. If you don't let go of your guilt, you'll build a self-image as a bad person. Clinging to your guilt gives you an excuse to be lazy. Fifth, if I let myself stop feeling guilty, this means I approve of my own actions. On some level, you might think that allowing yourself to live guilt-free means that you are fine with the things you've done. It doesn't have to be this way. You can recognize when you've done something wrong, learn from it, and then move on. Releasing your guilt doesn't mean you approve of your actions. It just means you've decided not to give them too much time and attention. Sixth, if I make a mistake, I am an unacceptable human being. This thought can be traced back to a single core belief. I must be perfect or I am worthless. This belief is both illogical and harmful. No one is perfect. Seventh, if I keep analyzing the situation long enough, I can work out exactly how much of the blame I deserve. Some of us want to know precisely what went wrong. Unfortunately, in most cases, there's no objective way to figure this out. It's smarter to invest your energy looking forward instead. Do you feel guilty for having fun? We all have the right to relax and have fun. In fact, taking time off is important for our mental and physical health. Sadly, many of us feel bad the moment we make time for ourselves. We tell ourselves we're being selfish. This is often a problem for parents, especially mothers, who are expected to put other people first. Here are a few beliefs you might need to shake. First, parents who want time alone are selfish. In reality, parents who want alone time are smart. Happier parents are more patient with their children. Second, putting yourself first makes you a bad person. It's not wrong to look out for your own interests. Caring for yourself is a basic life skill. Third, unless you are working all the time, you are being lazy. Most of us need to work to earn a living, but we need to balance it with downtime. Fourth, enjoying yourself is a waste of time. Making good memories isn't a waste of time. What's more, some people have their best ideas when they are relaxed outside of working hours. Fifth, it's bad to have a good time when other people can't join in. You are not responsible for everyone else's well-being. Sixth, you need to help other people solve their problems before you can relax. In general, There's nothing wrong with taking a break from solving everyone else's issues and focusing on yourself for a while. Let's try an exercise called scheduling alone time. Over the coming week, schedule at least 1 hour of alone time. You may need to get up earlier or go to bed later. If you work, you could get creative with your lunch hour. No matter how busy your lifestyle, you need to take time for yourself. If your family or friends try to make you feel guilty for spending time alone, that isn't your problem. You may need to set boundaries. Explain that you need a break from time to time, and you expect them to honor the time you set aside for yourself. Making amends. CBT is action-oriented, and therapists encourage clients to make amends for their mistakes if possible. For instance, if you feel guilty because you lost your temper with a friend, you could call them up and apologize. When you apologize, don't make it about yourself. Do not give excuses. Simply tell them that you are sorry, that you regret causing them hurt, and that you will never do it again. If they have any questions, answer them truthfully. Note that no one has to accept your apology. Sometimes people feel that words are not enough. This is why you have to rely on yourself for closure. You won't always get it from someone else. Don't be surprised if the other person tells you that you have nothing to worry about. You might find that you've blown the incident out of proportion. In fact, they may have forgotten about it altogether. This is humbling. It's a gentle reminder that the world doesn't revolve around you. Feeling guilty when things go well. So far, we've looked at the kind of guilt you might feel when something goes wrong. But what about the kind of guilt you feel when you realize how lucky you are? For example, if you were born into a family with plenty of money, you are probably in a far better position than someone born into poverty. Good fortune can make you feel guilty. Let's try an exercise. Imagine that tomorrow morning you wake up to learn that you've won the lottery. Give yourself a moment to really get into this fantasy. How do you feel? After the initial shock has worn off, are there any other feelings mixed in with your happiness? When you truly accept how many things in our lives come down to chance, you'll start to feel less guilty when you catch a break. On a slightly more morbid note, remember that even the most privileged among us aren't protected from accidents, death, and illness. If your luck turns against you, you'll regret wasting time feeling bad about how good you have it now. Finally, remember that feeling bad doesn't usually help others feel better. If you can let yourself enjoy your good fortune, then at least one person gets to be happy. Think back to the last time you went through a hard time. Would you really have felt better if everyone else felt guilty because they weren't going through the same thing? Probably not. When to get further help. If you are finding it difficult to understand whether something really was your fault or the event left you traumatized, it's time to seek professional help. Sorting out what happened can be upsetting and confusing after abuse or trauma. To summarize this chapter, guilt and regret are normal feelings, but they can be destructive if you cling to them for too long. Creating a responsibility pie lets you own your role in a situation and then move on. If you hold unhelpful beliefs about guilt, you will spend a lot of time feeling regretful unless you work on letting them go. Make amends to people you have hurt if possible, but don't expect closure. We all have our share of good and bad luck. There is no reason to feel guilty when things go well. Chapter 9: How CBT Can Help You Beat Addiction. Let's start Chapter 9. 1 in 3 people is addicted to at least one substance or behavior. You can become addicted to anything that gives you pleasure or a feeling of reward. Drugs, alcohol, nicotine, and gambling are the most common. Other addictions include shopping, using the internet, and work. Signs you have an addiction. You might be addicted to a substance or behavior if several of these signs apply to you. First, if it's having a negative effect on your day-to-day life. Second, if you've tried to stop or cut down but haven't succeeded. Third, if you get withdrawal symptoms when you try to stop. Fourth, if you are willing to engage in risky behaviors to get more of the substance or to engage in the behavior. Fifth, if you've lost interest in your old hobbies. Sixth, if you are ashamed of your behavior. And finally, if you've stopped caring about your appearance. How do addictions develop? Addiction begins when you experience a rush of pleasure or a high after using a substance or engaging in a behavior. Our brains are very good at working out what makes us feel good, so we start to crave it again. The more often you do it, the stronger the habit becomes. When you are addicted to something, you suffer withdrawal symptoms when you attempt to stop. For example, if you are addicted to online gaming and try to stay away from the internet, you might feel agitated and preoccupied with gaming. If you are addicted to alcohol, you might suffer tremors and headaches when you try to stop drinking. The quickest way to stop these symptoms is to give in to your cravings. This makes you feel better for a while, but keeps the cycle of addiction going. Several risk factors can make you more vulnerable to addiction. Psychologists think there is a genetic component. An addiction can also be a coping mechanism for things like bereavement, job loss, or an untreated mental illness. Spending time with others who have addictions also puts you at risk because it makes the behavior seem normal. A word of caution: CBT isn't always enough to cure an addiction. If you are addicted to a substance, you might need other forms of help, such as supervised detox or medication to cope with the physical effects of withdrawal. If your addiction has damaged your relationships, you may need therapy to rebuild trust. How do CBT therapists treat addiction? CBT for addiction is usually given as a structured program. Treatment is normally broken down into 4 stages: assessment, behavioral change, cognitive change, and relapse prevention. Every recovery program is different, but most feature these components. Stage 1 is assessment. In addiction therapy, assessment is made up of the 5 W's. Ask yourself the following. When? At what times do you engage in addictive behavior? Is it harder to control on weekdays or weekends? Where? Where do you buy substances, or where do you engage in the behavior? Do you drink more at a friend's house or use the internet compulsively when you are alone? Why? What compels you? Are there any internal or external cues that seem to come up again and again? Do you crave alcohol whenever you feel anxious? With or from whom? Who is normally around when you act on your cravings? Do you have any friends or relatives with the same addiction? What happens? What feelings do you get when you act on your cravings? A sense of pleasure, relaxation, or something else? Do you feel distressed by your behavior? These questions are designed to give you an insight into your personal patterns. Let's try an exercise called a behavior record. Draw up a table with the following headings: situation, thought, feelings, behavior, and consequence. The next time you act on a craving, make notes under each heading. Complete as many records as you can over the coming week. In time, you'll start to notice patterns. For instance, you might notice that you tend to go online to play games immediately after coming home from a stressful day at work. The situation would be coming home from the office. Your thought might be, I need to unwind. Your feelings could be, I'm stressed and want a distraction. Your behavior would be, spent all night on the computer. And the consequences would be, felt tired, missed dinner, argued with my partner. Stage 2 is behavior change. Answering the 5 W's and keeping behavior records will help you discover your triggers. These are situations, people, and feelings that you associate with addictive behaviors. Triggers can be internal, like stress, or external, like spending time with people who also engage in the behavior. In summary, triggers and cravings work like this. You encounter a trigger, like a bar, which causes a thought, like, I could get a drink, which leads to a craving for alcohol, which leads to the addictive behavior of drinking. A key part of CBT for addiction is to consciously decrease the time you spend in these high-risk situations and increase the time you spend in low-risk situations that don't trigger you. Here are a few tips. First, work out how much time your addiction currently takes up and choose activities that will fill that time completely. The less time you have to dwell on your addiction, the better. Second, choose activities that are totally incompatible with your trigger situations. For instance, do not join a hobby group that meets near a mall if you are trying to overcome a shopping addiction. Third, try to find hobbies that genuinely excite you. Addictive behaviors give your brain a big jolt of pleasure. You might have to try a few new activities before you find one that fills the void. Fourth, reward yourself every time you pick a healthy activity over spending time in a high-risk situation. Fifth, spend time with people who aren't struggling with an addiction. You need to spend time with individuals who lead balanced lives. Here's an exercise on avoiding triggering situations. How can you plan to avoid them? What could you do instead? Set yourself a challenge. Over the coming week, replace at least 2 triggering situations with low-risk activities instead. Stage 3 is cognitive change. The way you think about your addiction can make just as much of a difference as how you manage your triggers. Unhelpful beliefs about addiction and craving will hold you back. For example, you might believe, if I have a craving, that means I'm going to give in. But the reality is you don't have to act on your urges. Cravings can feel very compelling, but you can resist them. You might believe, I can't cope with my cravings. The reality is that overcoming addiction is tough, but people can and do recover. They aren't injured or killed by their cravings. They get through them. You can do the same. You might believe, if I have a relapse, all the days I've spent free from addictive behavior don't count. The reality is that a lapse doesn't undo all your good work. This is a classic example of all or nothing thinking. A healthier way to look at it is to congratulate yourself for your recent progress and then proceed as best you can. You might believe, if I have a lapse, it means I'll never be able to quit. The reality is you have a choice after a lapse. You can indulge in doom and gloom thinking, or you can look at the situation, try to learn from it, and vow to do better next time. Finally, you might believe, I can have just one drink. The reality is that every time you act on a craving, you are reinforcing the addictive behavior. Take a moment to review the evidence. Is it really true that you can have just one? When you tried to moderate your behavior in the past, what happened? Be honest with yourself. Practical tips for handling cravings. Here are some practical tips for when cravings strike. First, surf the urge. When you feel a craving, don't try to push it away. Pause, take a deep breath, and tune into your body. Cravings don't last forever. They peak and then subside. Tell yourself that you can observe the craving and wait it out. Second, acknowledge and talk about the craving. Telling someone how you feel can make a craving feel less scary. Phone or text a friend. Third, use thought stopping. Picture a big red stop sign whenever you notice unhelpful thoughts creeping in. For example, if you catch yourself thinking, I need a cigarette, imagine the stop sign popping up and blocking the thought. Fourth, find a distraction. Choose a distraction and immerse yourself in it for half an hour. Pick something that will hold your attention, especially if it involves practical work or exercise. Good distractions include playing music, journaling, going for a brisk walk, or deep cleaning the bathroom. Fifth, use positive self-talk and affirmations. Remember, challenging your thoughts and replacing them with more helpful ones is a big part of CBT. When a craving hits, remind yourself that you are trying your best, you've already made progress, and you'll feel very proud of yourself when the craving passes. Stage 4 is relapse prevention. It's normal to have lapses when recovering from an addiction. A lapse is a brief slip-up. For example, if you have a gambling addiction, buying a scratch card would be a lapse. Lapses can be discouraging, but they don't necessarily mean you are spiraling back into full addiction. As long as you frame your lapse as a slight setback instead of a complete disaster, you can quickly get back on track. Use positive self-talk. Instead of telling yourself that you are a failure, remind yourself that the road to abstinence is often bumpy. Learning how to say no. Social situations and people can be a big trigger. To conquer your addiction, you need to work out how you will handle high-risk social interactions. Practice what you will say the next time someone offers you a substance or encourages you to act on a craving. Write down your responses and rehearse them in front of a mirror. Good responses are short, memorable, and assertive. For example, no, thank you, I don't drink, or I don't smoke, or no, thank you, I've quit. Make eye contact and use a firm, even tone of voice. Some people don't take the hint the first time, so you might have to repeat yourself. A friend is someone who wants the best for you. Anyone who tries to stand in the way of your sobriety is not your friend. People who respect you will respect your boundaries. Some addicts find that to change their lives for the better, they need to form healthier friendships. To summarize this chapter, it's possible to be addicted to anything that makes you feel good. If you are addicted, your life will probably suffer. CBT helps people overcome addiction by giving them a framework to identify triggers, change their behaviors, think about their addiction in a new way, and prevent relapse. Addictions have a social component, and to stay abstinent, you might need to develop new friendships. Chapter 10, Using CBT to Overcome Jealousy. We now begin Chapter 10. CBT is most often used for treating mental illness and stress, but it can benefit anyone struggling with common problems, including relationship issues. In this chapter, you're going to learn how to handle jealousy. Jealousy in relationships. Do you worry that your partner is cheating on you, even if you don't have any evidence? Are you always watching them in public in case they are checking out other people? A little jealousy in a relationship is normal and can even be healthy. It keeps us vigilant. The trouble starts when you let jealousy destroy your peace of mind, or when you start fighting with your partner despite having no proof of betrayal. Jealousy can become a self-fulfilling prophecy. It's usually based on a fear of loss. Unfortunately, your jealous behaviors can push your partner away. Jealousy is unattractive, and someone with healthy self-esteem won't want to stay with a jealous or possessive partner. So, what can you do about it? CBT can help. Just like any other feeling, jealousy is associated with a set of thoughts and assumptions. Identifying and challenging your thoughts is the first step. Is your jealousy productive or unproductive? Productive jealousy is useful. It points out where things have gone wrong in a relationship and gives you a starting point for change. For example, if you are jealous because your partner spends lots of time with their best friend, your jealousy could encourage you to have an honest conversation with your partner about wanting more attention. Unproductive jealousy doesn't prompt useful change, just worry and rumination. If you are dwelling on something you have no control over, such as the possibility that your partner is flirting with a colleague, you have a choice. You can either leave the relationship, learn to work with your jealousy, or stay until both of you become unhappy. Working with unproductive jealousy. Just like anxiety and depression, jealousy has cognitive and behavioral components. When you understand how they fit together, you can find a way through your feelings. The key is self-acceptance, plus a willingness to step back and see your thoughts from a new perspective. The next time you get caught up in jealousy, ask yourself these questions. First, am I using emotional reasoning? Jealous people think that because they feel jealous, there must be a good reason for their worry. This isn't true. You can still feel jealous even if your partner hasn't done anything wrong. Feelings aren't always a reliable guide. Second, am I assuming that jealous thinking is protecting me? No one can keep their partner from cheating just by worrying about it. Ultimately, it's up to both parties to stay faithful. Realizing this can be quite liberating. You aren't responsible for your partner's behavior, only for how you respond. Third, what will these feelings of jealousy cost me? We've already established that jealousy isn't attractive. Imagine that you never overcame your jealousy. Imagine what would happen in your relationship. Picture your partner's exasperated face as they try to reason with you or tell you they are leaving. Fourth, what underlying beliefs are fueling my jealousy? Jealousy is often rooted in a feeling that you aren't good enough. People who value themselves don't live in fear that their partners will leave. If you are jealous for no logical reason, it's time to take a close look at your self-esteem. Do any of these sound familiar? I'm not very attractive or interesting. I can't make it on my own. People always betray me, so I need to look out for myself. If my partner left me, no one would ever want to date me. It's important to be honest with yourself, because you will never move past your jealousy unless you tackle these beliefs. Let's try an exercise. When you listen to the list above, did any thoughts jump out at you? Where do you think these thoughts came from? Have they always been a problem, or did something happen to make you think this way? When you develop a more positive self-image, you will feel less jealous. You will realize that you are worthy of a supportive relationship and that you don't need someone else's validation to feel good about yourself. The following exercise is a thought experiment that will help you realize you can cope with the end of a relationship. When you acknowledge that the end of your relationship wouldn't be the end of the world, jealous thoughts will lose some of their hold on you. Here's the exercise. Picturing the worst. Close your eyes and imagine that your jealous thoughts were proved true. For example, if you worry that your partner is cheating, imagine coming home and discovering them in bed with someone else. What can you see and hear? How are you feeling? Now, imagine that the relationship has ended and you are alone. What would you do next? Picture yourself picking up your life and slowly starting again. Picture yourself feeling and working through your emotions. This exercise isn't enjoyable, but if you repeat it regularly, the thought of your partner cheating won't seem quite so terrible. Betrayal is immensely painful, but this visualization will help you see that you can handle it if it should happen. Learning to tolerate uncertainty. No one can predict the future. Unless you spend every hour with your partner and take away their phone, it's possible that they will cheat on you. Your relationships will feel much more relaxed when you learn to live with uncertainty. Forgive yourself for feeling jealous. Berating yourself won't benefit you or your partner. It's unrealistic to shut down all jealousy forever. It's something you'll live with all your life, but it does get easier. Envy and unhelpful comparisons. Envy is fine in small doses. Just like romantic jealousy, it can even be helpful. It can give you valuable clues about what you would like to achieve. For example, if you feel envious whenever a friend earns a master's degree, it might be a good idea to think about going back to school. However, if you spend a lot of time feeling envious of others, your self-esteem and relationships will suffer. Your friends will realize that you envy them. Your body language and tone of voice will give you away. They might begin to feel uncomfortable talking about themselves, which will weaken your relationships. So what can you do when envy strikes? Here's a step-by-step guide. First, acknowledge how you feel. Take a deep breath and identify your feelings. If you like journaling, write them down. Second, identify what you think the comparison says about you. Tap into your core beliefs. For instance, let's say you are envious because a friend has earned a promotion. You might start to think, I'm stuck in my career. I'll never get the job I want. I'm too stupid. Third, challenge the thought. Are your thoughts really accurate? To continue the example, do you know with 100% certainty that you'll always be stuck in a job you hate? What do you gain by holding on to this thought? What would you tell a friend in the same situation? Fourth, ask yourself whether you are idealizing someone else's life. By focusing on only one part of someone, you are dehumanizing them. You're more complex than that, and so is the person who triggered your envy. Fifth, draw on your problem-solving skills. If you want to make a significant change in your life, reframe your envy as a reason to make a plan for how you can meet your goals. Let's do an exercise. Have you ever envied someone who later turned out to be struggling with serious problems? Now flip it around. What do you hide from the world? Most people edit their lives to make them seem happier than they are. This exercise is a reminder that no one is perfectly happy all the time. The best fix for envy. When you value yourself, other people's successes aren't a threat. You can admire and congratulate them without feeling jealous. People who accept themselves know that worth isn't a zero-sum game. Everyone is equally worthy as a human being. Here's an exercise. Why are you awesome? You'll need to work with a trusted friend or family member for this one. Ask them to help you make a list of your best qualities. Getting a second opinion makes the exercise more powerful. Next to each trait, write down 3 pieces of evidence. For instance, if you regularly help your elderly neighbor with their shopping, that would be strong evidence that you are kind. Read through the list when you need a boost. To get the most from it, add extra traits and evidence whenever possible. Self-appreciation is a powerful skill. It not only helps you cope with envy and jealousy, but bolsters you against depression. To summarize this chapter, jealousy in a relationship can be healthy in small amounts, but unproductive jealousy can be destructive. Challenging your underlying beliefs about jealousy and yourself will help you feel better. Realizing that you could cope with a relationship ending is empowering. No one can predict the future. Accepting this will help you come to terms with jealousy. Envy is normal, but you need to keep it in check. Acknowledging your feelings, identifying unhelpful thoughts, and practicing self-appreciation can conquer envy. Chapter 11. Becoming more assertive and coping with criticism. Now we begin Chapter 11. In a healthy relationship, both people can talk about their needs, and they can give and receive constructive criticism without feeling threatened or rejected. Unfortunately, many of us aren't very good at this. We might worry that our partner will resent us, or maybe we just don't know how to start a conversation without getting whiny or angry. What's more, we may find it hard to process criticism, even if it's loving and carefully worded. This is where assertiveness training comes in. When you behave assertively, you stand up for your wants and needs while respecting your partner and the relationship. But assertiveness goes beyond behavior. It's about adopting a mindset that will help you communicate and develop healthy relationships. In this chapter, you'll discover how to stand up for yourself and assert your rights. You'll also discover how to handle criticism so you can learn and grow from feedback. So what does it mean to be assertive? To understand what assertive behavior is, you can compare it with passive, aggressive, and passive-aggressive behavior. First is passive behavior. Passive people put others' needs before their own. They do what they are told. When someone criticizes them, passive people don't fight back. They automatically agree in an attempt to please the other person. Typical beliefs of a passive communicator might be, other people know more than I do, so I should listen to them. Or if someone criticizes me, it means I am a bad person. Or it's rude to stand up for your own needs. Next is aggressive behavior. Aggressive people believe that their desires should come first. If they believe someone is getting in their way, they will lash out, either verbally or emotionally. When an aggressive person is criticized, they either dismiss it or become angry. They see criticism as an insult. Typical beliefs of an aggressive communicator might be, my opinions and needs are more important than theirs, or being angry is the only way to get respect, or attack is the best form of defense. Third is passive-aggressive behavior. Passive-aggressive people may appear compliant on the surface, but their behavior makes it clear that they aren't happy. They might resort to sabotage. For instance, they might agree to a task they don't want to do, but then do such a bad job that no one asks them again. When criticized, they might respond in a sarcastic or dismissive way. Typical beliefs might be, confrontation is bad, so I have to use sneaky tactics. Or it's unsafe to stand up for myself, or other people can't tell me what to do. Finally, we have assertive behavior. An assertive person tries to balance their needs with those of others. They know they won't always get what they want, but they believe in standing up for their rights. They make themselves heard without using intimidation. When an assertive person receives criticism, they evaluate whether it's true or helpful before responding. They have robust self-esteem that can't be damaged by negative feedback. Typical beliefs of an assertive communicator are, I'm important and worthy, and so is everyone else. Or my self-worth doesn't depend on what anyone else thinks. Or I can handle difficult conversations. So, how can you become more assertive? First, you need to identify any mental blocks you have. Second, you need to master some practical communication techniques. Let's do an exercise. Based on the descriptions above, how would you describe your communication style? Some of us are a mix of two styles. You might use different styles depending on who you're talking to. Challenge your beliefs about assertiveness. How do you feel when you picture yourself as an assertive person? Nervous? Anxious? Many of us carry around unhelpful beliefs about what it means to be assertive. Here are a few common ones, along with more helpful alternatives. You might believe being assertive means being a bully. An alternative thought is, bullies are not assertive, they are aggressive. Being assertive is about striking the right balance. You might believe If I'm assertive, I'll drive everyone away. An alternative is, confident, friendly people will respect me if I'm assertive. You might believe, it's not very ladylike to be assertive. An alternative is, women are taught from an early age that it's unfeminine to be assertive, but it's actually good to be an assertive woman. Assertive women get what they need and want. You might believe, it's okay for others to be assertive, but my own needs don't matter. An alternative is, everyone has basic needs. Everyone has the right to be heard and respected, that includes me. Finally, you might believe, unless I take a tough love approach, people won't respect me. An alternative is, assertive people are usually more respected than angry, aggressive people. Assertive communication is just as effective, and everyone else will probably like me more, not less. Practical tips to become more assertive. Here are some practical tips. First, start saying no more often. Are you a people pleaser? The only solution is to learn how to decline requests and invitations. For example, suppose your sister wants you to babysit on Friday, even though you know you'll be tired. Instead of saying yes, you could use one of the following assertive responses. No, I can't. I'll be too tired. I hope you find another solution. Or, thank you for asking me, but I've got to say no this time. Or simply, no, I'm not available that night. Practice by saying no to low-level requests. No is a complete answer. If someone doesn't respect it, that's their problem, not yours. Second, use I statements. You statements can sound accusatory. Try to start sentences with I need, I feel, or I would like instead. Keep statements simple and to the point. For example, I need to leave by 6 o'clock. Or this will cost $1,200. This is called simple assertion. I statements are also useful for explaining how you feel, like I feel angry or I feel worried. You can also use them to show empathy while still asserting your own needs. For example, I understand that you don't like having dinner earlier, but until I get settled into my new job, I'd like you to accept this routine. Third, watch your body language. Your posture and voice make a big difference. Keep your arms and legs uncrossed, sit or stand up straight, and keep your shoulders relaxed. Keep your tone of voice even, never shout. Fourth, use the broken record technique. If someone tries to overload you with objections, rephrase and repeat your original response. Persistent people may ask the same question several times, but even the rudest individuals will get the message eventually if you stand by your answer. Don't get sidetracked. Fifth, find an assertiveness role model. Do you know someone who is assertive without being aggressive? Watch them carefully and see what you can learn. Sixth, focus on behavior, not character. If you want to ask someone to change their behavior, use this formula. First, state their observable behavior. Second, tell them how it affects you. Third, tell them how this makes you feel. Finally, tell them how you would prefer them to act in the future. For example, when you don't pick up ingredients for dinner when you promised to, it means I have to go get them myself. This makes me feel tired and disrespected. In the future, I'd like you to either pick them up or let me know in plenty of time if it won't be possible. Seventh, spell out consequences. If asking someone to change their behavior doesn't work, the next step is to assert consequences. This is a last resort, and only when you are in a position to impose sanctions. Never make empty threats. Stay calm and civil. For example, I have asked you to tidy your bedroom, and you have not done it. If you don't do it by tomorrow, I will confiscate your phone over the weekend. You have the right to put your safety first. Don't force yourself to be assertive if doing so would be unsafe. If someone is being abusive or you think they will become very angry, it's best to excuse yourself from the situation as soon as possible. Let's try a role-playing exercise. Role-plays are a safe, effective way to practice your assertiveness skills. Ask someone you trust to play the role of someone who makes unreasonable requests. Repeat the role-play several times until you feel confident. How to handle criticism. No one is perfect. We all receive criticism from time to time. It isn't much fun, but it can be helpful. If you can accept feedback and act on it, you'll make more progress than people who block out criticism or become overly defensive. Here's a quick exercise. When was the last time someone criticized you? Did you make the most of the feedback, or did you try to block it out? Take a moment to think about how your response to criticism might be holding you back. Here are 8 steps to handling criticism. Step 1. Remind yourself that criticism doesn't determine your self-worth. You are a valuable human being, regardless of what anyone says about you. Step 2. Take a deep breath and wait a moment before reacting. It's better to pause for a few moments than say or do something you regret. Step 3. Consider the source. Not all criticism is created equal. Do not assume that it is true or justified. Be prepared to take to heart the criticism that makes sense and dismiss the rest. Step 4. Ask clarifying questions if the other person is being vague. If someone gives you general negative feedback, ask for more information. Step 5. Try to focus on the words, not the tone. Some people lack self-awareness and may not know how to keep their tone of voice steady. Step 6. Diffuse the criticism if it's destructive, inaccurate, or unfair. You can agree with criticism in part, in principle, or in probability. This takes the sting out of the criticism. First, you can agree in part. If the criticism is partly correct, pick out the relevant details and repeat them back. For example, if someone criticizes you, "You're lazy, you never help around the house," you can respond, "You're right that I do rarely walk the dog." Alternatively, you could agree in principle. If someone says, "You aren't using the right software, we'll lose our data," you can respond, "True, if there are security bugs, then we could lose some data." Finally, you can agree in probability. This involves acknowledging that something could happen. If someone says, "If you don't start budgeting, you'll be broke by next year," you can respond, "You're right, I could run out of money." Step 7. Apologize if necessary. If you have made a mistake, own up to it. Step 8. Decide on an action plan and share it if appropriate. If the criticism is fair, explain what you will do differently in the future. Finally, reward yourself. Not many people are good at working with criticism. If you can master this skill, your performance at work will improve, and your self-respect will blossom. To summarize this chapter, being assertive doesn't come naturally to many people. There are 4 main communication styles: passive, passive-aggressive, aggressive, and assertive. Using I statements, monitoring your body language, and learning how to say no are key steps. Dealing with criticism can be tough, but you can learn to accept it, diffuse it, and use it as a tool for growth. Chapter 12. CBT and Mindfulness. Welcome to Chapter 12. Over the past decade, mindfulness has become increasingly popular in the world of psychology. Mindfulness-based cognitive therapy, or MBCT, combines principles of classic CBT with breathing exercises, meditation, and mindful practices that help you accept reality exactly as it is. In this chapter, you'll learn what mindfulness is, why it's such a powerful tool, how it's inspired a new kind of therapy, and how you can use mindfulness exercises to improve your psychological well-being. What is mindfulness? Mindfulness is simply the act of paying attention. When you are in a mindful state, you are fully present. You aren't obsessing about the past or fretting about the future. You are just in the moment, processing events as they happen. When we are mindful, we're more likely to feel calm and safe. Why is mindfulness a good thing? Compare mindfulness with its opposite, mindlessness. If you lead a busy life, you probably go through your days on autopilot. Have you ever driven to work and realized you have no memories of your trip? Or sat down to eat a meal and suddenly discovered all the food is gone? Living mindlessly means missing out on your life. Mindfulness helps you re-engage with the world, moment by moment. Understanding the differences between classic CBT and MBCT. You can use both CBT and MBCT exercises, mixing and matching as you like. However, they are based on different approaches. First, CBT invites you to challenge your thoughts, whereas MBCT encourages you to accept them. Throughout this audiobook, you've been weighing evidence for and against your thoughts. MBCT takes a different approach. Like CBT, it involves noticing destructive thoughts. However, MBCT practitioners teach their clients how to accept them. MBCT techniques help you stay grounded in the present moment and wait for the thoughts to pass instead of fighting them. Second, MBCT focuses on preventing depression and anxiety, whereas CBT is used as a treatment for people who are already experiencing an episode. MBCT is recommended for people who have experienced multiple episodes of depression. It's also used to help people living with chronic pain. Third, MBCT does not focus on problem solving or behavioral activation. Problem solving and behavioral activation are key skills in CBT that help you take action. MBCT doesn't emphasize these techniques. MBCT is about being, whereas CBT is about doing. Fourth, MBCT is usually delivered in a group therapy format. MBCT is normally given in a structured group format that lasts several weeks. Clients are asked to practice new techniques between sessions. However, this doesn't mean you can't benefit from some of the techniques used in MBCT. Some research suggests that group and individual therapy are equally effective. Here are 3 exercises you can try. They are similar to those practiced in MBCT classes. The first is a body scanning exercise. Sit or lie down somewhere comfortable. Start by bringing your awareness to your entire body. Notice the weight of your body against the chair or the bed. Inhale, hold the air in your lungs for a few seconds, then exhale. Repeat this several times. Next, focus on your feet. Notice their weight and temperature. Move your awareness up to your lower legs, then your thighs, buttocks, and trunk. Pay attention to how your back feels. Pay attention to your shoulders. If they are hunched or tight, take a deep breath and let them drop. Is your jaw clenched? Let it soften. If your hands are balled into fists, exhale and deliberately relax your fingers. Repeat this exercise at least 3 times per day for 20 minutes each time. The second exercise is mindful eating. For this exercise, you will need a small piece of food that you can chew or suck for a few minutes, like a raisin. Find a quiet place where you won't be interrupted for 5 minutes. Hold the food in one hand. Notice how it feels, its temperature, its texture. Put it up to the light. What color is it? Now, smell the food. How would you describe it? Next, put the food in your mouth, but don't bite into it yet. Roll the food on your tongue. What does it taste like? What is the texture like? Finally, swallow the food. Feel it go down your throat. This is a great exercise to do at the start of a meal. It can encourage you to stop eating when you start to feel full. The third exercise is a walking meditation. Most people assume that you need to sit still for hours to meditate, but that's not true. If possible, choose surroundings that are green and calm. Relax your shoulders and maintain a good posture. As you step forward, notice how it feels when your foot meets the ground. As you walk, use all your senses. What can you hear? What can you smell? What can you see? Take a few deep breaths. What does the air feel like in your lungs? What to do if your mind just won't stay still? Mindfulness and meditation practices are simple, but that doesn't mean they are easy. The biggest obstacle will be your mental chatter. It's normal for your mind to leap from thought to thought. The Buddhists have a term for this, the monkey mind, because the mind is like a monkey swinging from branch to branch. No one has a completely still mind. The difference between novice and expert practitioners is that experts have long ago accepted that their brains will always be hyperactive. Being mindful isn't about removing every thought from your brain. Radical acceptance. Radical acceptance is a technique developed by psychologist Marsha Linehan, who also devised dialectical behavior therapy, or DBT. To help her clients make peace with difficult situations, Linehan suggested they try radical acceptance. Here's an exercise in radical acceptance. You can either wait until you are in a difficult situation to try this technique, or you can practice it by deliberately thinking about something that makes you angry or upset. Start by telling yourself that you don't have to approve of a situation to accept it. Take a few deep breaths. Say to yourself, okay, this is happening. I don't have to do anything about it. I don't have to fight it. I just have to let it be, and it will pass. This exercise is harder than it sounds. Your mind will still spin, and you'll still feel the urge to blame someone. When this happens, bring your attention back to your breathing. When you feel a little calmer, ask yourself these questions. What led up to this event? Did you play a part in causing this problem? What part did other people play? Did luck come into it? And finally, you have a choice. You can choose to accept the situation or rail against it. Which approach do you think will be more constructive? We like to think that we can control everything in our lives. It's a comforting illusion. However, it just isn't true. Life is unfair sometimes. Learning to accept life as it is may be scary, but it is enormously liberating. To summarize this chapter, CBT therapists are increasingly using mindfulness in their work. Mindfulness exercises ground you in the present moment. Mindfulness-based cognitive therapy, or MBCT, is a structured form of therapy that draws on principles of both CBT and mindfulness. You can use MBCT-style techniques like mindful eating and meditation for yourself. Mindful acceptance, or radical acceptance, can help you make peace with whatever life throws your way. Conclusion: you should feel very proud of yourself. You've taken a long, hard look at your destructive thought patterns, and you've started to think and behave in brand new ways. That takes courage and determination. Your efforts will soon pay off. People and situations that used to drag you down won't seem like such a big deal. Sure, you'll still face the normal trials of everyday life, but you'll be better at shaking them off. CBT techniques get easier the more you practice them. It's like driving a car. It feels awkward at first, but it becomes second nature within a few months. Train your brain now, and you'll reap the benefits for decades. Until recently, therapy was taboo. Thankfully, more people are realizing that therapy isn't just for people with diagnosed mental health problems. We can all benefit from learning how to stop negative thoughts from taking over our lives. So when your family and friends ask why you are so much happier, why not be honest and tell them about how CBT has changed your life? You can play your part in starting a CBT revolution. If you take only one thing away from this audiobook, let it be this: you aren't at the mercy of your thoughts or emotions. They might feel overwhelming, but don't be fooled. Ultimately, you are the one in control. Realizing this simple but powerful truth is the first step toward real empowerment. Welcome to the second part of this audiobook, focusing on mindfulness. Imagine a treatment for anxiety, everyday stress, and depression that doesn't involve drugs, has no unpleasant side effects, costs nothing, is available anywhere, can be used by anyone, and has been scientifically proven to work. There really is a solution that ticks all these boxes. It's called mindfulness. In this section, you're going to learn what mindfulness is, how to make it part of your everyday routine, and how it can transform your life. You'll discover simple practices to help you feel better on every level, physically, psychologically, and spiritually. By the end of this audiobook, you'll see the world and yourself in a whole new way. The future will feel less scary. The past will no longer cause you pain. You'll find it easier to forgive yourself and others, develop self-compassion, and find inner peace. The only tools you need are an open mind and patience. You don't need to invest in special equipment, go on any retreats, or change your religious beliefs. You definitely don't need to become a Buddhist monk or renounce the modern world. At the same time, this audiobook will challenge you to examine your values and lifestyle. For example, you'll be encouraged to ask yourself some tough questions about how you spend your time. The path ahead will be challenging, but it could be the most important journey of your life. Perhaps you've tried therapy, self-help books, medication, and support groups. Maybe these measures helped for a while, but they didn't lead to real change. It's time to try a new approach. Mindfulness is a way of life. It lets you befriend your authentic self, the real you hiding under years of social conditioning and unhealthy habits. When you accept yourself, you can take your life in a new direction. This sounds like a paradox, but by the time you finish this audiobook, this simple idea will make perfect sense. Are you ready? Let's begin. Chapter 1: What is mindfulness? Let's begin the first chapter of our mindfulness journey. Mindfulness has become a buzzword in personal development circles. You may have seen articles about it, or even been offered mindfulness seminars at work. So what is mindfulness in a single sentence? Mindfulness is the basic human ability to be fully present, aware of where we are and what we're doing, and not overly reactive or overwhelmed by what's going on around us. Psychologist Shauna Shapiro, an internationally renowned mindfulness expert, explains that there are 3 key components to mindfulness. First, intention, or paying attention on purpose. Second, attention. And third, attitude, specifically an attitude of non-judgmental acceptance. At first glance, the whole topic of mindfulness seems odd. After all, aren't we all aware of what we're doing? Unfortunately, the answer is no. Most of us go through life on autopilot. Our thoughts and emotions control us, not the other way around. Mindfulness is about learning how to accept and work with your mind and yourself. By extension, it's also about accepting your life and discovering the joy in ordinary everyday moments. You can think of mindfulness as the opposite of mindless action. When we behave mindlessly, we zone out. We stop experiencing our own lives. For example, have you ever sat down to eat a meal only to get distracted by your phone or your own racing thoughts? If so, did you look down at your plate and realize all the food was gone? Mindless eating isn't satisfying, and it can even make you gain weight. Let's try an exercise as an introduction to mindfulness. To appreciate what mindfulness means, you need to experience it for yourself. First, go outside and find a leaf. If you can't find one, a small pebble will also work. Second, set a timer for 5 minutes. Third, look at the leaf as though you've never seen a leaf before. Turn it over slowly, take in its color, shape, weight, and texture. Put it up to the light. If your mind starts to wander, bring your attention back to the leaf. This simple practice shows you what mindfulness is all about. By focusing all your attention on a single object, you have no choice but to live in the present. Here's another quick exercise: tracking your wandering mind. Keep a pen and paper with you throughout the day. Every time you catch your mind wandering away from your current task, make a mark on the paper. It should only take you a few hours to see why mindfulness will benefit you. Where did mindfulness come from? Modern mindfulness practices have ancient roots in Buddhism. To understand the link, it's helpful to understand what Buddhism teaches about the mind. The Buddha taught his followers that most human suffering is self-generated. Although external events can cause us pain, it's how we think about and respond to these events that matters most. He also believed that humans make themselves unhappy by grasping after things they don't have, such as relationships and material possessions. As long as we have these cravings, we will never be satisfied. The key to inner peace is to understand and then detach ourselves from these cravings. Common cravings include the desire for money, status, and beauty. There's nothing wrong with wanting these things, but when we start making them the central focus of our lives, we're in trouble. So, how can we learn to identify and overcome these cravings? Buddhists turn to meditation to help them become aware of their cravings. Gaining insight into the workings of one's own mind is a key step to overcoming suffering. The difference between mindfulness and meditation. The words mindfulness and meditation are often used interchangeably, but it's important to be clear on the differences. Meditation is normally a formal seated practice. There are several types, including mantra-based meditation, guided meditation, and loving-kindness meditation. We'll take a closer look at these practices in later chapters. You have to make time for a meditation session. Mindfulness can take the form of meditation, but it goes beyond formal practice. You can be mindful anywhere. In summary, you don't have to practice meditation to be mindful. However, formal meditation is well worth trying because scientific research has demonstrated its positive effects. Mindfulness doesn't solve your problems. Instead, it provides you with a space to simply sit with them and accept your situation for what it is. Buddhists refer to mindfulness practices as sati. The Satipatthana Sutta, known as the Discourse on the Foundations of Mindfulness, is the most important Buddhist text on mindfulness meditation. The text outlines Buddha's teachings, framing mindfulness as an essential faculty anyone can develop. According to the sutta, mindfulness has to be deliberately cultivated. The Buddha frequently referred to the 4 foundations of mindfulness. First, the body. When you are mindful, you notice how it feels to live in your body. You notice your breathing patterns, posture, and any aches or pains. Second, feelings. Mindful people are willing to face their feelings, knowing that all emotions are transient. They are prepared to label feelings as they arise, watching them come and go. Third, consciousness. Mindful people acknowledge not only their emotions, but their general state of mind. For instance, during a mindfulness session, you may acknowledge that you are tired or content. Fourth, dharma. This Sanskrit word roughly translates to the nature of things or law of nature. It can refer to Buddhist teaching, but it can also describe the world around us. Someone in tune with their personal dharma is following their unique path or calling. This audiobook isn't an in-depth discussion of Buddhist philosophy, but it's helpful to understand the roots of contemporary mindfulness. How Buddhist ideas entered Western medicine. In the 1970s, biologist Professor John Kabat-Zinn pioneered a new approach for people living with chronic illness. Over an 8-week period, he trialed a stress reduction program based on mindfulness practices. The course teaches people how to use mindful activity to cope with day-to-day stress and chronic pain. Although he was heavily influenced by Buddhist teachings, Kabat-Zinn teaches mindfulness from a secular perspective. His approach is now known as mindfulness-based stress reduction, or MBSR. Since those early days, mindfulness has become a popular tool for therapists, trainers, and coaches. Hundreds of studies have shown it to be effective for people with anxiety, depression, stress, and other forms of emotional distress. Why do we need mindfulness? In the Western world, stress and mental illness are at an all-time high. One possible cause is our hectic lifestyles. There are also many global problems to worry about, and thanks to the internet, it's easier than ever to read about them. We also have to contend with social media, which can encourage us to make unhelpful comparisons. We need psychological defenses against the stressors in our lives. If we are to solve society's problems, we need to work together. Mindfulness can help us adopt a compassionate attitude and increase our empathy. For example, one study showed that people who went on an 8-week meditation course were 3 times more likely to help a stranger in need. If enough of us learn to be mindful of others, society could change in a profound way. What does the research say? Mindfulness isn't just appealing on a common-sense level. It's also backed up by rigorous scientific research. Here are a few key findings. First, mindfulness makes you more resilient in the face of stress. Mindfulness practices can't make life's problems disappear, but they can help stabilize you during trying moments. Second, mindfulness can improve your relationships. Married couples who score higher on measures of mindfulness are happier. This makes sense. If you are mindful in your relationships, you'll be better at staying calm and communicating your emotions. Third, mindfulness can enhance your working memory. One of the most exciting benefits of mindfulness is its effect on cognitive functioning, which includes planning tasks, staying focused, and committing new information to memory. By learning how to be mindful, you'll feel less flustered and forgetful. Fourth, mindfulness can improve your physical health. Psychologists have discovered that mindfulness can strengthen your immune system and reduce chronic inflammation. Some researchers have even speculated that regular mindfulness practices could slow down the aging process. Fifth, mindfulness can help you make better choices. Our lives are defined by our decisions. Mindfulness practices teach you how to make sound decisions based on facts, rather than your emotions or irrational fears. Staying mindful lets you avoid making poor decisions that come back to haunt you later. In summary, mindfulness offers a lot of benefits for a minimal time investment. Most of the exercises in this audiobook take 10 minutes or less. To summarize this chapter, mindfulness is the act of paying attention. It's not the same as meditation, though meditation is a useful way to practice. Mindfulness is rooted in Buddhism, but you don't need to change your religious beliefs to use it. Finally, mindfulness offers lots of physical and psychological benefits, including reduced stress and a more effective immune system. Chapter 2: Simple Mindfulness Exercises. Now we begin Chapter 2. In the last chapter, you got a brief taste of mindfulness. In this chapter, you'll learn several more exercises that will help you lead a more mindful life. Later in this audiobook, you'll discover how mindfulness can help you overcome specific problems such as depression and anxiety. First, we're going to cover 3 practices that take less than 5 minutes. These are general exercises you can use anytime. The more you use these tools, the better. First is mindful breathing. Watching your breath is the simplest practice of all. The aim is to breathe as usual while attending to the sensations in your body. First, sit or lie down. Second, close your eyes if you prefer. Third, pay attention to your breathing. Observe how it feels to inhale and exhale. Fourth, if your thoughts start wandering, bring your focus back to your breath. The second practice is tasting food. We take eating for granted, but when was the last time you slowed down and really appreciated a meal? This practice uses food as a focal point. First, choose a small piece of food, such as a raisin or a nut. Second, look at the food carefully. Notice what it looks like, feels like, and smells like. Third, put the food in your mouth. Notice how it tastes. Move it around your mouth for a couple of minutes. Finally, chew it carefully and swallow. Pay attention to the sensation of the food moving down your throat. You'll probably notice various thoughts popping into your head. That's okay. Just keep your attention on the present moment as much as possible. The third practice is listening to music. Any kind of music can be a meditation tool, but a soothing track will make the experience more relaxing. First, sit or lie down comfortably. Second, play the music. Third, follow each note. Pay attention to the pitch and tempo. If your mind conjures up images or memories, observe them. Fourth, as the track ends, pay attention to how your body feels. Does it feel lighter or heavier? Fifth, pay attention to your mood. Do you feel calmer? Whatever you feel is perfectly normal. The aim is to practice noticing what is going on in your mind and body. Now for some longer practices. If you have more than 5 minutes to spare, try a body scan or a mindful walk. Once or twice a week is enough, especially when you're first starting out. Let's try a body scanning exercise. This makes for a wonderfully relaxing start or end to your day. First, set aside at least half an hour. Second, lie down on a comfortable surface. Third, close your eyes. Fourth, notice your breath. Fifth, inhale and switch your attention to any part of your body. Sixth, notice any sensations that arise, like tingling, warmth, or aching. Take an attitude of curiosity rather than judgment. Seventh, when you have finished scanning your body, focus on your breathing again. When you're ready, open your eyes and sit up. Next is a mindful walking exercise. Research has shown that walking in a green space improves your mood and sharpens your concentration. Here's how to take a mindful walk. First, before you begin walking, tune into your body. Notice your posture and temperature. Second, start walking, moving slightly slower than usual. Third, as you walk, notice how your heels, then your toes make contact with the ground. Fourth, take deep breaths. Fifth, keep your gaze soft. Sixth, when emotions and thoughts pop up, acknowledge them without judgment. Seventh, walk in this way for as long as you like. Eighth, end your practice slowly, feeling the earth beneath your feet. Any of the exercises in this chapter will help you feel less stressed. To summarize this chapter, the 3 simplest mindfulness exercises involve focusing on your breath, tasting some food, and listening to a piece of music. Body scanning is a longer practice, but is well worth trying if you have the time. Mindful walking is a great alternative if you feel too restless to sit still. You don't have to use all the practices. Using 1 or 2 a few times per week is enough to trigger real change. Chapter 3, How to Meditate. It's time for Chapter 3. You don't have to start meditating to lead a mindful life, but give it a try. You'll be glad you did. Meditation reduces stress, helps reduce anxiety, enhances your attention span, improves your memory, lowers your blood pressure, and promotes better sleep. In this chapter, you'll experiment with 3 types of meditation: mantra meditation, loving-kindness meditation, and guided meditation. When meditating for the first time, keep your expectations realistic. It takes time to cultivate your attention span, so aim to meditate for 5 minutes at first. 20 or 30 minutes per day is ideal, but a few times per week is much better than nothing. Be prepared to experience a range of emotions. You may feel self-conscious, anxious, or frustrated. This is completely normal. Sit with these feelings and gently bring your attention back to your breath or mantra. Let's start with mantra meditation. Mantra is a Sanskrit term meaning a tool used to liberate the mind. Mantra meditation involves focusing on and repeating a mantra internally. It provides a point of fixation for your mind, cutting through mental chatter. Here's how to get started. First, pick a mantra. Mantras should be short, positive, and easy to repeat. Some people prefer traditional mantras such as Om. Using a mantra in a language you don't understand can help you concentrate. However, you may find that an English mantra holds more appeal. Popular mantras include, I am enough, I change my thoughts, I change my world, and I love you, I am sorry, please forgive me, thank you. Second, sit down in a quiet place. Third, close your eyes. Fourth, set your intention. Decide why you are meditating. Do you want to calm down or feel a sense of kinship with others? Fifth, ground yourself with some deep breathing for a couple of minutes. Sixth, begin repeating your mantra. Keep a steady rhythm. Seventh, when your mind wanders, pull your focus back to the mantra. Eighth, repeat your mantra for as long as you like. Next is loving kindness meditation. This helps you foster goodwill towards yourself and others. Here's how to do it. First, with your eyes closed, sit in a comfortable position. Second, take a few deep breaths. Third, begin by receiving love from others. Imagine that someone who has shown you kindness is standing to your right. Feel the love emanating from them. Now imagine another person you love standing to your left. Again, feel their love and compassion. Fourth, picture yourself surrounded by everyone who cares for you. Welcome their love and care. Fifth, think about the person standing to your right. Send them love. Say to them, may you live with ease, may you be happy, may you be free from pain. Sixth, repeat this, but this time direct your love to the person on your left. Seventh, next, think of a neutral person in your life, like someone who serves you at the grocery store. Say to them, just as I wish to, may you also live with ease and happiness. Eighth, repeat this, but this time, send your good wishes out to the world as a whole. Some people also send love to people they actively dislike. This can be healing, but may also stir up difficult emotions. Start with the practice above, and then extend it if it feels safe to do so. Finally, there's guided meditation. This involves following instructions from someone else. By following their voice, you enter a state that helps you relax and cope with challenging emotions. Some guided meditations ask you to focus on your breathing. Others involve visualizations, like entering a mental safe space. If you want to try guided meditation, you can attend a class or buy recordings. There are also plenty of free guided meditations online. You can find some on websites like tarabrach.com or chopra.com. You can also write your own guided meditation scripts, record them, and then play them back as you meditate. Respect your meditation time. Create a peaceful meditation area in your home. A spare room is ideal, but a corner of your bedroom or living room will work. Make it special with a cushion, candles, or an inspiring picture. If you live with other people, you may need to get up earlier or go to bed later to carve out some time for yourself. Stick with it. Research shows that meditation actually raises your energy levels. To summarize this chapter, you don't have to meditate to lead a mindful life, but many people find it helpful. Mantra meditation involves focusing on a word or phrase. Loving kindness meditation is a way to send love and warmth to yourself and others. Guided meditations are useful if you want some support. You can attend a class, download meditations, or create your own. Chapter 4, Reducing Stress and Negativity with Mindfulness. It's time for Chapter 4. We all have to deal with stress. In this chapter, we'll look at how mindfulness can reduce your stress levels and help you become a more positive person. First, a note of caution. You can't lead a stress-free life. Stress is part of the human experience. A modest amount of stress is actually good for you. For instance, stress can give you the edge at work. When stress becomes harmful, prolonged stress has a devastating effect on our minds and bodies. When you feel stressed, your body releases a hormone called cortisol. Cortisol is useful in emergencies, but research has shown a link between elevated cortisol and serious diseases like type 2 diabetes and obesity. So, can mindfulness help get your cortisol levels under control? Absolutely. One study showed that cortisol levels dropped significantly after just 8 weeks of mindfulness training. Mindfulness and letting go. Many of us are addicted to the idea of being in control. We like to think that we can control our relationships, careers, and finances. To some extent, this is correct. But the reality is that many events are beyond our control. The prospect of accepting reality for what it is can be terrifying. Buddhists believe that our addiction to control is an unhealthy attachment that only results in suffering. Paradoxically, the better you are at accepting your distress in any given situation, the happier you will become. Mindfulness isn't the same as apathy. You might assume that if you give up fighting for control, you'll give up on life. Society teaches us that those who push themselves to succeed are to be praised. The key to a more relaxed life is to accept that the only thing you can really control is your response to life. This is an empowering position. It doesn't mean you can't make plans, just that you realize everything is impermanent. Noticing stress in your body. Having accepted that stress is normal, the next step is to train yourself to pick up on your early warning signs. Here are some clues that your stress levels are rising. Your head feels foggy and you find it hard to concentrate. Your appetite changes. Your muscles feel tense. You feel as though you could cry. You have a headache or migraine. You experience palpitations. You seem to be sweating more than usual. Your skin feels itchy. Use the basic mindfulness exercises from Chapter 2 to check in with yourself throughout the day. How to handle the signs of stress. Often, merely tuning into your body and sitting with your feelings is enough to lower your stress levels. The following exercise will help you cope with short-term stress. It's called riding the wave of stress. The next time you start feeling annoyed, try this. First, wherever you are, stand or sit still. Second, take a deep breath, then briefly scan your body. Third, watch for signs of stress. Fourth, imagine that your stress is like a large wave crashing towards you. Fifth, as the wave reaches its peak, picture yourself literally riding or surfing it. Sixth, let yourself feel proud for negotiating the wave while remembering you will need to keep doing this throughout your life. Mindfulness, long-term stress, and burnout. What about stress that accumulates over time? The kind that leaves you feeling burned out and depleted? Burnout can happen to anyone. It's a state of complete physical and emotional exhaustion. Here are the most common signs. Feeling as though every day is a bad day, no longer finding any enjoyment in your life. Feeling taken for granted, feeling tired and drained every day. Frequent minor illnesses, aches and pains, and changes to your sleep or eating patterns. Stress is a sign that you care too much. Burnout is when you start checking out. Nothing seems to matter anymore. Some people are more prone than others to burnout, especially perfectionists with an all-or-nothing thinking style. So, how can mindfulness prevent burnout? Mindfulness helps you let go of things you can't control, which short-circuits stress. It also helps you appreciate what is going well. Finally, living in the present alerts you to the first signs of burnout. Research shows that mindfulness practice can lower the risk of burnout in high-stress professions. Mindfulness and negativity. By definition, no one enjoys negative feelings, but they are a fact of life. Learning to work with your negative emotions will help you weather the storms of life. Human beings tend to focus on negative events. This is known as the negativity bias. Our ancestors needed to remain alert to threats, but this tendency can make us miserable if we pay too much attention to everything that upsets us. Mindfulness helps you accept negative emotions. Most people make the mistake of trying to argue themselves out of their negative emotions. They tell themselves things like, "Other people have it worse," or "just pull yourself together." Unfortunately, these strategies don't work long term. They are all forms of avoidance, which only creates further tension. As spiritual teacher Eckhart Tolle notes, what you resist persists. If you want to recover from your scariest feelings, you must embrace them. Let's try an exercise for working with negative emotions. First, as soon as you realize you're feeling a negative emotion, pause and take a few deep breaths. Second, let yourself acknowledge the emotion. Say, "There is anger in me," or "I feel sad." Third, hold the emotion. Accept that it's there. Don't fight it. After a couple of minutes, you'll realize that even the strongest emotion doesn't define you. Fourth, watch the emotion ebb and flow like a wave. Remember that no feeling lasts forever. Fifth, once you have made peace with the emotion, you can undertake some gentle investigation. Ask yourself what triggered it. Let's try another exercise. Name it, tame it. This practice puts some distance between you and your emotions. First, when you feel a negative emotion, stop and pause. Take a few deep breaths. Second, as you feel each emotion, label it, speaking aloud. For example, sad, angry, frustrated. Third, as you label each feeling, acknowledge it. Give it space. The dangers of emotional contagion. Do you know someone who always leaves you feeling negative or depressed after just a few minutes in their company? This phenomenon is called emotional contagion. Mindfulness helps us respond to people in a sensitive way without getting caught up in their emotions. The first step is to work out who in your life is bringing you down. Here's an exercise. How does this person make you feel? The next time you meet up with someone, check in with your body before and after your time together. Compare how you felt before and after. Does your body feel more or less tense? Is your breathing slower or faster? Repeat this exercise with different people over a few weeks. You'll start to notice that some people leave you feeling energized and positive, while others drain your spirit. How to respond to other people's negativity. Staying mindful when you're dealing with someone else takes practice. Try to stop taking everything personally. Realize that someone else's bad mood has nothing to do with you. Psychologist David J. Pohle calls this the law of the garbage truck. He points out that most people carry around problems and bring their negative attitude wherever they go. If you aren't careful, they will happily dump it on you. The next time someone tries to offload their negativity onto you, smile and deflect the conversation. At the same time, remember that you never know the full story. Try to give them the benefit of the doubt. You can also create a pause policy. If someone sends you an email or text that stirs up difficult feelings, wait at least an hour before responding. Spend less time with negative people. You might want to think about spending less time with negative people. You can't order your coworkers to leave, but you can reduce the amount of time you spend with toxic friends. Being mindful doesn't mean you have to tolerate bad behavior. Focus on surrounding yourself with people who make you feel peaceful and happy. Gratitude and negativity. Negative people focus on what is going wrong in their lives. This is why gratitude practices are useful if you're trying to kick the negativity habit. Here's an exercise. Grateful thank yous. Over the course of a day, many of us say thank you several times. But do you feel grateful, or has it become automatic? The next time you say thank you, pay attention to why you are thanking the other person and take the opportunity to feel gratitude. Here's another exercise. Take 5. When you next feel frustrated, grab a piece of paper and write down 5 things you are grateful for. Do you have access to washing facilities? Clean water? Nutritious food? That's 3 things right there. Do it anyway, even if you don't feel like it. Studies have proven that gratitude practices help most people feel better. Mindfulness and emotional intelligence. Mindfulness enhances your emotional intelligence, or EQ. People with high EQs are skilled in identifying and handling their feelings. They are also adept at picking up on other people's emotions. By learning how to face and sit with your negative emotions, you'll be able to acknowledge and deal with tough situations. Emotionally intelligent people are more likely to take risks because they know they can handle fear and disappointment. Facing up to your own feelings can also help you channel them in a healthy way. For example, you might decide that a workout would help you let go of your anger. You'll start making healthier choices, which will have a powerful knock-on effect. To summarize this chapter, some stress can be positive, but too much is a health risk. Mindfulness helps you monitor your body and mind for signs of stress. It can also protect you against burnout. Sitting with and accepting your negative emotions can make them seem less overwhelming. Mindfulness helps shield you from other people's negativity. Cultivating mindfulness will improve your EQ because you will learn how to tune into your feelings. Chapter 5. Mindfulness and Anger Management. Let's begin Chapter 5. There's nothing wrong with getting angry when the situation warrants it. Anger inspires us to defend ourselves and correct injustice. However, too much anger takes its toll on your mind, body, and relationships. If you have an anger problem, mindfulness practice will help you learn how to spot the warning signs that your anger is spinning out of control. Anger doesn't always come from the outside. The common sense view is that anger is triggered by external events. However, anger can also stem from a loss of joy, Psychologist Stephen Danziger points out that no mood state is permanent. It's unrealistic to expect that we can be happy all the time. Some people find this hard to accept, and their disappointment may manifest as frustration or anger. So, how does mindfulness help? Mindfulness helps you check in with your body, detect the early signs of anger, and respond in a way that doesn't harm you or others. Let's try an exercise. How angry are you? If you suspect you have an anger management problem, start checking in with yourself every 2 to 3 hours. Ask yourself, on a scale of 1 to 10, how angry am I right now? How does my body feel? What emotions am I feeling? What thoughts are going through my head? This practice helps you detach from your emotions. Here's another exercise called RAIN. This practice, developed by teacher Michelle McDonald, can be used to handle any difficult emotion. It is especially useful for taming anger. RAIN stands for Recognize, Allow, Investigate, and Nurture. First, recognize. Begin by giving yourself permission to feel your anger. Label it. Say, I am angry. Scan your body for sensations that signal anger. Second, allow. Hold your anger. Let it just be there. Don't try to reason it away. If you can sit with your anger, you'll learn that it doesn't have to overwhelm you. Third, investigate. Only after you've recognized and felt your anger can you explore what triggered it. Take an attitude of gentle curiosity. Ask what happened immediately before you felt fury bubble up. Over time, you'll start noticing your personal anger patterns. For example, you might notice that you get angry when you think someone has failed to respect your authority. Discovering your triggers gives you an advantage. Fourth, nurture. Anger is often a sign that your needs are going unmet. However angry you may be, you deserve self-compassion. You also need to learn how to nurture yourself when others won't. Self-care is an essential part of the RAIN exercise. Have a bath, do some exercise, or do something else that makes you feel good. Congratulate yourself for taking responsibility for your feelings. Any progress is great. If you frequently get angry, cut yourself some slack. Your anger won't disappear immediately. You deserve lots of praise for trying a new approach. Get mindful about your thought patterns. The next time you get angry, watch your thoughts. Reframe them as clues to your anger patterns. Do you notice any of the following? Blaming. Do you shift responsibility onto other people? Do you say things like, it's her fault, or he always makes me mad? The truth is that no one can make you mad. You have a choice. Overgeneralizing. Do you use words like never or always? For example, you never listen to me. These statements are rarely true and only escalate tension. Using should. Do you feel as though people should act fairly towards you at all times? This isn't how the world works. Shoulding will keep you miserable. Mind reading. Do you assume you know what someone else is thinking? Assumptions can lead to unnecessary arguments. Don't beat yourself up if you notice yourself falling into these traps. The trick is to spot your thinking errors and realize that you don't have to identify with them. Grudges, past hurts, and releasing anger. What about grudges and long-term grievances? It's worth addressing old hurts because they can cause needless pain. Here's an exercise using mindful visualization to release anger. This helps you let go of simmering resentment. First, find a quiet place. Second, close your eyes and imagine a peaceful scene outdoors. Third, when an angry thought pops up, imagine encasing it inside a large pink bubble. Visualize the thought inside the bubble. Feel a sense of relief. Fourth, picture the bubble floating off into the sky until it is out of sight. Be willing to see change in other people. Living in the present helps you make a fresh start in your relationships because you can see someone as they are now, not as they were in the past. People can and do change. Try to stay open to the possibility of reconciliation. This doesn't mean you have to forgive and forget, or rekindle a relationship with someone who has mistreated you. On the other hand, if your grievance is relatively minor and a lot of time has passed, why not try casting your assumptions aside? When to seek help. These exercises are no substitute for professional help. If your anger is disrupting your relationships or career, it's best to make an appointment with a doctor or therapist. Most mental health professionals are happy to use mindfulness as part of a treatment plan. To summarize this chapter, Anger is not an intrinsically bad emotion, but too much can harm you. Mindfulness practices can help you identify anger in your body, accept it, and release it. Identifying your personal anger patterns can help you overcome thinking errors. Staying mindful can help you appreciate positive change in other people. You can use mindfulness when working with a mental health professional who specializes in anger management. Chapter 6: Depression and Mindfulness. Let's begin Chapter 6. Depression is a complex illness. It can be caused by genetics, upbringing, and negative life events. However, people diagnosed with depression seem to think in similar ways. Their thought patterns are unhelpful and destructive, keeping them locked in a cycle of misery. Symptoms of depression include low mood or sadness, feeling hopeless and helpless, low self-esteem, feeling guilt-ridden, feeling irritable, having no motivation, and finding it difficult to make decisions. You may also notice physical symptoms such as aches and pains, and social symptoms like a reluctance to spend time with others. The link between thoughts and moods. You don't have to believe everything you think. You have the power to see thoughts for what they are. Just thoughts. Professor Mark Williams, a mindfulness expert, said, "Gradually, we can train ourselves to notice when our thoughts are taking over and realize that thoughts are simply mental events that do not have to control us." Back in the 1960s, a psychiatrist named Aaron T. Beck was researching depression. He realized that depressed people tended to have negative thoughts about themselves, negative thoughts about the world, and negative thoughts about the future. His research made one thing clear: your thoughts shape your mood. Beck believed that depressed people needed to challenge their unhelpful thoughts. He invented a new form of therapy, cognitive therapy, or CT, to help his patients. For example, a therapist might help a client identify a thought like, "Nothing I ever do is good enough." The therapist would then work with them to challenge it using logic and reason. They might help the client think of times they have succeeded. Together, they might come up with a new belief, such as, "I am capable of succeeding sometimes, and my work is often good enough." Critics of CT say that it's unrealistic to expect people to challenge every single negative thought. Also, if you are depressed, you might not have the mental energy to argue with your thoughts. The mindful alternative. Mindfulness practitioners agree that our thoughts maintain our emotional states. However, they disagree with Beck on one key point. Instead of just challenging unhelpful thoughts, they believe depressed people also need to learn how to sit with unpleasant feelings. We're going to look at how mindfulness can help alleviate the symptoms of depression. Depression sucks the joy from almost all situations. Mindfulness exercises can put you back in touch with your own capacity to experience pleasure. This starts an upward spiral. Please note, although mindfulness has been shown to help with symptoms of depression, these practices are not a substitute for professional medical advice. If you are depressed, work with your doctor or therapist. Depression, concentration, and focus. An inability to concentrate is a common symptom of depression. Sufferers find it difficult to read, follow TV shows, or even take part in conversations. Fortunately, mindfulness has been proven to enhance concentration. Research shows that practicing mindfulness regularly for only 7 weeks is likely to improve your attention span. The following practice is a great way to train your attention span. It's called counting to 10. First, sit or lie down comfortably. Second, take a few deep breaths, keeping your attention on your breathing. Third, as you breathe in, count 1. Fourth, as you exhale, count 2. Fifth, continue until you reach 10. Sixth, if you notice your mind wandering, bring it back to the present and start over. This sounds simple, but it may take a lot of practice. Stick with it. Depression, gratitude, and counting your blessings. When you're depressed, the world is a bleak place. Gratitude practices affirm that there is still hope and kindness. They can inspire moments of peace and joy. Don't confuse this with the cliché, count your blessings. Counting your blessings usually means rattling off a list. Gratitude practice involves slowing down and mindfully appreciating your resources and relationships. Mindfulness enables you to accept whatever is going on in your life. Gratitude practice doesn't involve guilt. Let's try a gratitude exercise. Start by reflecting on the positive things in your life. Think small. Give thanks for the clean water in your glass, the shoes on your feet. Next, reflect on things that are not necessarily good, but may offer you opportunities for growth. For example, problems at work might encourage you to search for a new, more satisfying position. Research shows gratitude exercises can make a big difference. Gratitude reduces feelings of depression, boosts well-being, and improves sleep quality. Mindfulness, acceptance, and releasing guilt. If you've ever had depression, you're probably familiar with phrases like, "What have you got to be depressed about?" or "Count your blessings." This kind of advice doesn't help. It makes you feel guilty for being depressed. Mindfulness teaches you to accept your depression for what it is. Having depression doesn't make you a bad or ungrateful person. It means you are struggling with a mental health problem. To recover, you need to show yourself some compassion. Here's a mindfulness exercise for self-compassion. This is a quick practice for when you are tempted to judge yourself harshly. First, when you catch yourself thinking self-critical thoughts, pause. Second, decide you are going to be mindful for a few moments. Third, gently place your hand over your heart. Fourth, slowly take a few breaths. Fifth, let yourself feel emotional pain. Acknowledge that you are suffering. Aim to do it a few times per day. Depression and your self-image. Depressed people don't feel good about themselves. A poor self-image and low self-esteem help keep the cycle of depression going. Mindfulness can help break the cycle by giving you a healthy distance from your emotions. Let's try another exercise called, "I'm having the thought that." The next time you notice a self-deprecating thought, add, "I'm having the thought that" in front of it. For instance, if you catch yourself thinking, "I'm so lazy," tell yourself, "I'm having the thought that I'm so lazy." The thought may or may not disappear, but it won't feel quite so personal. Preventing relapse with mindfulness-based cognitive therapy, MBCT. Mindfulness-based cognitive therapy, or MBCT, is an extension of traditional CT. It helps people recognize unhelpful thinking styles and learn to accept them without judgment. MBCT is particularly useful for people who have had 3 or more previous episodes of depression. Zindel Segal, one of the founders of MBCT, points out that people who have recovered from depression are easily triggered to relapse when they experience a sad mood. MBCT helps people learn to accept their emotions, preventing them from spiraling into another episode. MBCT is usually taught as an 8-week group program. However, you can still enjoy the benefits by practicing MBCT exercises by yourself. Here's an exercise called the 3-minute breathing space. This exercise takes 3 minutes. During the first minute, ask yourself, "How am I right now?" Notice any sensations, feelings, and thoughts. During the second minute, simply follow your breath. During the final minute, move your attention from your breath outwards so that you are noticing sensations throughout your body. Here's a second exercise, mindful dishwashing. Washing the dishes is an excellent opportunity to use all your senses. As you wash a plate, notice how the water and soap feel. Look at how the water and suds slide around the plate. Hear the sloshing of the water. With practice, this mundane task can become a rewarding part of your day. To summarize this chapter, if you're suffering from depression, you probably experience a lot of negative thoughts. Mindfulness practitioners believe that learning to accept them is more effective than challenging them. MBCT works by reducing rumination and preventing the downward spiral that can lead to depression. Mindfulness can also help people with depression release guilt, grow self-compassion, improve their self-image, and enjoy moments of pleasure. Chapter 7, Mindfulness Exercises for Anxiety and Panic Attacks. It's time for Chapter 7. People who can keep their attention on the present moment rarely experience anxiety. They acknowledge that the future may be unpleasant, but they aren't caught up in the pain of anticipating it. Mindfulness training can reduce worry and fear. In this chapter, you'll learn how mindfulness can help you cope with the symptoms of anxiety and panic attacks. What is anxiety? Anxiety is a feeling of fear, worry, or unease. Some anxiety is normal and healthy. It can give you an edge and help you prepare for important situations. On the other hand, chronic or severe anxiety wreaks havoc on your body and mind. Psychological symptoms include being irritable, feeling uneasy, and difficulty sleeping. Physical symptoms can include feeling faint, an upset stomach, headaches, and palpitations. Can you be too anxious to practice mindfulness? If you are very anxious, mindfulness might feel impossible. You may try to observe your breathing, but feel your anxiety rising. Self-critical thoughts like "I can't do this right" can creep in. Fortunately, you can ease yourself into mindfulness by working on self-compassion. Let's try an exercise called self-compassion mindfulness for anxiety. First, sit upright in a comfortable chair. Second, acknowledge that you are suffering from anxiety. Tell yourself out loud, "I'm acknowledging that I'm in a lot of emotional pain. My suffering is real." Third, take a single deep breath. Fourth, affirm your pain again. This time, say "I'm caring for myself." Fifth, repeat step 3, but this time focus on 2 breathing cycles. Sixth, tell yourself, "This is hard for me. I accept that." Seventh, try to observe 3 breathing cycles. Eighth, again acknowledge that the practice is challenging. Repeat this practice as many times as you like. After a few sessions, you'll begin to notice the difference. The next practice uses drawing as a grounding exercise. It's called drawing mandalas. You've probably seen mandala coloring books for adults. The ancient practice of drawing and coloring mandalas has long been used as a form of meditation. Mandalas are abstract, circular designs made up of geometric or organic shapes. Here's how to draw your own. First, find a square piece of paper. Second, draw a small dot in the center. Third, draw 3 or 4 concentric circles around the dot. Fourth, let your intuition guide you when drawing your mandala. The only rule is that it should be symmetrical. Fifth, you can add color as you go or wait until you have completed your design. Sixth, as you draw, notice the sensation of the pencil in your hand. If you make a mistake, don't beat yourself up. The aim is to focus your attention on the act of drawing. You may even experience a flow state while drawing. During a flow state, you become completely engrossed in what you are doing. Time seems to fly by. You can't force yourself into a flow state, so just see it as a nice side effect. Mindfulness for panic attacks. Panic attacks are overwhelming feelings of anxiety combined with physical symptoms. During an attack, your body releases stress hormones, causing symptoms like nausea, irregular breathing, and palpitations. Panic attacks last up to half an hour, but most peak within 10 minutes. The good news is that they aren't harmful. Mindful approaches to panic attacks are becoming more popular. Instead of distracting yourself, try sitting with the sensations. Here's an exercise called sitting with a panic attack. First, the next time you detect the beginnings of a panic attack, pause and take a deep breath. Tell yourself, here we go. This is a panic attack. Second, remind yourself that your symptoms always pass. Third, adopt an attitude of curiosity rather than resistance. Notice your physical symptoms and label them, like sweaty palms or chest tightness. Fourth, watch your symptoms reach their peak, usually at the 10-minute mark. This exercise will help you accept what is happening. Here's another exercise called Say Stop. You can use it whenever you feel overwhelmed by worry. STOP stands for slow down, take a breath, observe, and proceed. First, stop. Whatever you're doing, pause. Second, if you're experiencing racing thoughts, say in with each inhalation and out every time you exhale. Third, observe. Consider how your body feels. Label your emotions. Remember that your thoughts and feelings don't always represent reality. Fourth, proceed. Pick an activity that will give you a psychological boost, like calling a friend or making a hot drink. Befriending anxiety. Harvard psychology professor Ron Siegel recommends that people with anxiety go one step further. He says you should not only learn to ride out waves of anxiety, but actually induce it. By deliberately triggering anxious feelings, you can practice letting them pass through you. Here's an exercise for inducing anxiety. First, sit quietly and scan your body for signs of anxiety. Second, if you can locate any feelings of anxiety, allow yourself to notice it. Third, if not, intentionally bring to mind a situation that makes you apprehensive. Fourth, breathe deeply and acknowledge your fear. Fifth, it won't be long before your mind wanders. When this happens, return to the anxious feeling. You'll soon notice that maintaining a state of anxiety is actually quite difficult. It fades within a few minutes. Working with your doctor. Mindfulness definitely works well for many people with anxiety. On the other hand, it's not a cure-all. You'll need to make lifestyle changes and possibly work with a doctor or therapist. If your symptoms are having a major impact on your life or self-help isn't working, consult a mental health professional. To summarize this chapter, mindfulness grounds you in the present, so it is useful for anyone who worries. Mindful drawing can alleviate anxiety. Mindfulness can help you cope with a panic attack because it has a grounding effect. Mindfully inducing anxiety teaches you that anxiety doesn't last forever. If you are too anxious to try mindfulness, acknowledging this anxiety can be a great help. If anxiety is interfering with your life and self-help isn't working, consult a doctor. Chapter 8. Building Better Habits with Mindfulness. Welcome to Chapter 8. Never underestimate the power of habit. Much of our day-to-day lives are shaped by repetition. The more you repeat a habit, the harder it is to shake. In this chapter, we'll look at how you can conquer undesirable habits and build new, healthy habits using mindfulness. Not all habits are harmful. Brushing your teeth is a habit. Good habits keep you aligned with your higher goals. It's only when our habits prevent us from fulfilling our potential that they become a problem. Overcoming bad habits. We all know what we mean when we talk about bad habits like smoking or watching too much TV. The problem with this phrase is that it invites judgment. By labeling a behavior as bad, we affirm to ourselves that our behavior is wrong. This isn't helpful because it triggers self-criticism. Instead, refer to habits that disrupt your life as unhelpful or unhealthy. This encourages a more compassionate attitude. Let's do an exercise to identify unhealthy habits. Over the next few days, make a note whenever you catch yourself engaging in habit-driven behavior that doesn't align with your values. For instance, if you value efficiency, compulsively checking your email every 10 minutes is an unhelpful habit. Ask yourself how you feel when you engage in this habit. Pretend you are a scientist. Act as a neutral witness rather than a critic. Some habits, such as smoking, are always harmful. However, others, like excessive internet use or overeating, are only a problem when abused. You can't stop eating or using the internet entirely, but you can learn to take a mindful approach and moderate your behavior. Why habits are so hard to break. To help understand why habits stick, let's look at two theories. The first is the dual operating systems theory. Economist Daniel Kahneman proposed that we have two operating systems for making decisions: System 1 and System 2. System 1 is driven by instinct and emotion. It urges us to take immediate action to relieve discomfort. By contrast, System 2 is based on rational thought. It allows us to think about the long-term effects of our actions. To put it simply, System 1 creates the urge to engage in unhealthy habits. When you try to suppress a habit, you are battling a powerful force. System 2 relies on the prefrontal cortex, the part of the brain responsible for long-term planning. It recognizes the cost of indulging in a craving. However, when you are under stress, the prefrontal cortex shuts down. So when you really need it, it's not much help. When we feel threatened, it's all too easy to give in to our urges. The second theory is the reward circuit. Trigger, behavior, reward. Psychologist Judson Brewer points out that our brains have evolved to form habits based on reinforcement. If something feels good, you'll want to do it again. Let's take a simple example. One day you see a delicious-looking piece of cake, a trigger. Your brain urges you to eat it, a behavior, because it suspects the cake will taste great. You eat the cake and it does taste fantastic. These sensations are your reward. Your brain then lays down a context-dependent memory. It creates a new pathway that lets you remember what you ate and where you found it. From a survival perspective, this is wonderful. It makes the cake harder to resist in the future. Your brain may then decide that cake is the answer when you next feel sad. Every time you respond to your triggers, you further cement this new habit. So how can we change? The picture might seem bleak, but you can change. You just need to adopt a new, more mindful approach. You need to take a proactive approach to blocking your behaviors and take an attitude of curiosity when you act on your impulses. Notice your triggers and put up some roadblocks. Having investigated your personal triggers, You can make adjustments to your environment that make it easier to practice healthier habits without relying on willpower alone. For example, if you have a habit of buying candy at the grocery store, plan a new route that doesn't take you through the candy aisle. If you check your email as soon as you wake up, start leaving your phone in the kitchen when you go to bed. Persistence is key. Psychologists believe it takes about 66 days to build a new habit. Focus on 1 or 2 changes at a time. Embrace your cravings. In Chapter 7, you learned that leaning into a panic attack can help it pass quicker. This exercise is based on the same principle. It's called urge surfing. First, as soon as you notice a craving, stop what you are doing. Second, sit or stand still comfortably. Third, tune into your body. Where can you feel the craving? Describe it in non-judgmental language. Fourth, pay close attention to how it feels. Do the sensations change or move around? Notice any thoughts that pop into your head like, just don't do it, or I can't bear this feeling. Fifth, breathe as normal for 1 to 2 minutes. Sixth, return your attention to where you are experiencing the craving. Imagine directing your breath towards it. Seventh, urges come and go in waves. Think of your breath as a surfboard. When a wave hits, take a big breath in. As it passes, exhale. Eighth, within 20 to 30 minutes, you'll notice that your urge has started to soften. Believe it or not, confronting urges can become fun. Curiosity is in itself rewarding. When you slip up, show yourself some compassion. You're human, and you will fall back into your old habits at some point. It's okay to be imperfect. Reaffirm your commitment to making changes and aim to be mindful next time around. To summarize this chapter, our habits dictate our behaviors. Our brains are hardwired to form habits and tend to become irrational under stress. Through mindfulness and observation, we can learn to surf cravings and make simple changes to our routines that prevent them. Try to take an attitude of curiosity rather than judgment. Show yourself compassion when you slip back into unhealthy habits. Chapter 9: Beating Procrastination and Boosting Productivity with Mindfulness. Let's begin Chapter 9. Procrastination isn't just an annoyance. It can do serious damage to your career, personal life, and self-esteem. In this chapter, we'll look at what procrastination is, why we do it, and how mindfulness can help us get back on track. What exactly does it mean to procrastinate? When we procrastinate, we delay a task. Most people associate procrastination with school and work. However, we also procrastinate in our personal lives. For example, some people vow to lose weight but never seem to get around to it. What are the dangers of procrastination? Procrastination carries health risks. Research shows that procrastinators are more likely to get sick and suffer higher levels of stress. It can also damage your relationships. If you delay making important decisions, like when to buy a house, your partner's patience may run out. Why do we delay tasks? We procrastinate because it offers some kind of payoff. Putting off important tasks leads to stress in the end, so why would anyone choose to delay them? Put simply, procrastination makes you feel better in the short term. Suppose you have to write a long, complicated report. If you tell yourself that you'll do it later, you immediately lower your stress levels. This sends a signal to your brain. If we delay a task, the tension goes away. This is why procrastination is best thought of as an unhealthy habit. Psychologists have found that low levels of mindfulness are linked to procrastination. People who procrastinate struggle to regulate their behaviors and emotions. By contrast, mindful individuals are better equipped to recognize and accept their emotions, even unpleasant ones, and continue with tasks anyway. If you start using the techniques in this audiobook, you'll be less likely to procrastinate. Procrastination and negative self-talk. Sometimes we procrastinate because we don't want to endure negative self-talk. If you are in the habit of putting yourself down, you probably speak unkindly to yourself when facing a challenging task, so it makes sense that you'd want to avoid it. If you are a chronic procrastinator, you need to figure out whether your self-talk is holding you back. Here's an exercise for noticing your inner critic. First, the next time you feel discouraged by a big task, slow down and check in with yourself. Second, notice the thoughts racing through your head. Third, if you notice a critical voice, what is it like? Quiet or loud? Male or female? Fourth, every time a new critical thought pops up, label it. Say, "Oh, a critical thought." Fifth, notice that each thought passes. Sixth, acknowledge your critic and then start the task anyway. Finding purpose at work. Do you ever arrive at work, look at your to-do list, and ask, what's the point? When you're caught up in the daily grind, it's easy to lose your sense of purpose. Here's an exercise. Why are you at work? Asking yourself a few questions each morning can renew your sense of purpose. At the start of every working day, ask yourself, what is my role here? How can I better serve others? What do I need to do today? And what must I do first? Even if your work is dull, you can still find some meaning. For example, if you have a boring administrative job, you could gain satisfaction from cheering up coworkers or reminding yourself that without your efforts, the business would descend into chaos. Why you need to stop multitasking. We all like to think we've mastered multitasking. Perhaps you are listening to this audiobook while doing something else. If so, switching off other devices and giving this audiobook your complete attention is a small act of mindfulness in itself. Multitasking can make you feel productive. Unfortunately, this is just an illusion. Research shows that multitasking lowers your productivity. If you get into the habit of multitasking, you lose your ability to focus long enough to assimilate new information. In other words, multitasking undermines your ability to learn. Mindfulness and monotasking. When you commit to completing tasks mindfully, you are forced to slow down and work through them one at a time. If you find this uncomfortable, notice your thoughts and feelings. Does monotasking make you feel lazy? Tune in and see what's going on inside. Stop multitasking for a week and see what impact it has on your life. Tech, productivity, and procrastination. Like it or not, technology is an inescapable part of our lives. But have you ever stopped to consider the real cost of your tech habits, especially when it comes to productivity? It takes only a few moments to get sucked into an internet rabbit hole. Even if you only spend a few minutes browsing, your brain will be overwhelmed. Fear of missing out, FOMO, envy, and insecurity. Do you have the feeling that other people are having a much better time than you? You may be experiencing FOMO, a modern condition usually triggered by technology. If you have FOMO, you probably feel inferior to people on social media. At worst, FOMO can be lethal. Some people are so worried they'll miss an update that they can't put their phones down when driving. If you suffer from FOMO, you aren't living in the present. The real problem is that you are missing out on your own life. How to use tech mindfully. So is technology evil? Not at all. We just have to figure out how to use it mindfully. Here are some tips. First, turn off all unnecessary notifications. They interrupt your workflow. If you are worried about missing something, acknowledge what's going on in your body and mind. Second, use a tracker to monitor your use. There are lots of apps designed to help you lead a more mindful life. You may be in for a shock when you see the numbers. Third, be mindful before reacting to people online. The next time you start typing an angry response, pause and reflect on what you are trying to achieve. The next time you are tempted, notice what that urge feels like. See if you can surf it instead of reacting. Fourth, use mindfulness to overcome FOMO. Research shows that being mindful reduces FOMO. The next time you feel jealous on social media, put your phone down and feel the emotion in your body. Breathe deeply. You'll notice the emotion peaks within a few minutes. Remind yourself that you have a choice. Fifth, don't feed someone else's FOMO. When you post on social media, be mindful of how your actions affect others. If you want to share photos, do it with a sense of appreciation, gratitude, and joy. To summarize this chapter, mindful people tend to procrastinate less. We procrastinate when we feel overwhelmed by negative emotions or want to escape our inner critic. Mindfully accepting these thoughts makes tasks more tolerable. Mindful questions can help you find a sense of purpose. Technology is an inescapable part of our lives, and we need to learn to use it mindfully. Chapter 10. Beating When-Then Syndrome with Mindfulness. Welcome to Chapter 10. So far, you've experimented with mindfulness practices for specific problems like stress and depression. In this chapter, we're going to take a step back and look at the bigger picture. Mindfulness isn't just a useful approach for handling emotions, It is a way of living. Are you living for the present or the future? Do you tell yourself any of the following? When I land that new job, then I'll be happy. When I buy a new home, then I'll be happy. When I find a partner, then I'll feel better about myself. These are examples of when-then syndrome. The main symptom is an obsession with making as much progress as possible while ignoring what's going on around you. If you're suffering from this, you'll never be able to accept your life in the present moment. Instead, you'll pour all your efforts into chasing whatever you think will make you happy. This is a tragedy because you will deprive yourself of the joys of living in the here and now. Why we need to enjoy the journey. Many of us assume we need to wait until we arrive at our destination before we feel happy. This perspective leads to pain. Why? First, when you pin all your hopes on a single event, you are vulnerable to disappointment. Few things live up to our expectations. To make matters worse, human beings often assume that success in one aspect of their lives will somehow change everything for the better. For example, you might trick yourself into thinking that a new relationship will suddenly make you happy and allow you to launch a new career. Imagine that you drop dead tomorrow having never achieved your goals. It's a grim thought. However, wouldn't it be even worse to die having never experienced life in the present because you were too busy striving? The brutal truth is that you don't know whether the future will ever arrive. Doesn't it make more sense to focus on learning to live in the here and now? Finally, by fixating on what you want, you are devaluing what you already have. You might start feeling resentful that your boss doesn't pay you enough, or that your current house isn't big enough. These thoughts keep you from enjoying your life as it is right now. Let's do an exercise. Today, keep a piece of paper and a pen on hand. Every time you drift off into a daydream about the future, place a mark on the paper. At the end of the day, count them up. Are you surprised by how much time you spend traveling? Cravings never end. There is always something new to desire. We set a goal, work towards it, feel happy for a brief time when we meet it. Then we start hankering after something new. Until you realize that material possessions and status will never bring you true contentment, you are trapped in a cycle of striving and disappointment. Consider this. You have always assumed that a particular person or possession will make you happy. You already know that life doesn't work like that, or you wouldn't still be searching for contentment. When you accept that you will always want the next big thing, you are free to choose goals that are actually meaningful to you and pursue them with joy rather than grim determination. The hedonic treadmill. If you are hoping that the right car or house will finally bring you contentment, you are headed for disappointment. Research has shown that accumulating memories, not material possessions, makes us happier. We soon become desensitized to new luxuries. The elation wears off and we start to look ahead to the next thing. This is known as the hedonic treadmill. On the other hand, memories last forever. If you mindfully enjoy the good times, you can conjure up these memories later and savor them again. Think twice before investing in a fancy gadget. Why not put that money towards an experience or adventure instead? Keep your mind and heart open. Life isn't predictable. The best laid plans go awry. The good news is that you have a choice. You can try to keep up the illusion of control, or you can remain open to multiple possibilities. Think back over your life. Have there been times where everything went wrong, yet it worked out well in the end? For example, you might have been fired from a job, but then found a better one. You can feel happy anytime, anywhere, if you fully accept the present moment and engage in the dance of life. To summarize this chapter, fixating on a future that may or may not arrive means you can't enjoy the present. Missing out on your life as it is right now is a greater tragedy than falling short of your goals. Don't assume that one achievement will magically fix everything else. Material possessions make us happy, but hedonic adaptation means these pleasures don't last. Be open to what the future may bring, and don't hold too tightly to your expectations. Chapter 11. Staying present while planning the future. Now we begin Chapter 11. At this point, you might be thinking, sure, staying in the present helps me live a more joyful life. but I can't stay in the present all the time. I've got to think about my future and make plans. In this chapter, we'll look at how you can strike this delicate balance. You'll learn how to set mindful goals and make positive decisions. Meditation and mindfulness in the real world. Most of us don't want to sell our houses and move to a monastery. We need mindfulness practices that work for ordinary people. Coach Brad Waters notes that being mindful doesn't mean you have to float along without a plan. It means that when you do make plans, they come from a place of appreciation and acceptance of what you currently have. In fact, mindfulness is a great tool for setting goals. Waters advises that mindful planning involves looking at what you want to be, not just what you want to have. Asking questions like, "What is my place in the world?" requires more self-reflection than listing things you want to buy. Let's try an exercise in mindful goal setting. The next time you set a goal, ask yourself the following questions. First, does this goal support my higher values? When your goals support your beliefs, you are more likely to stick with them. Second, am I being realistic? Set goals that stretch you, not goals that leave you feeling overwhelmed. Third, how will chasing this goal affect other people in my life? It's sensible to think mindfully about the broader effects of your goals. Fourth, when I imagine achieving this goal, how does my body feel? Close your eyes and visualize the moment you achieve your goal. Tune into your body. Does your heart rate increase? Do you feel a rush of energy? These are all good signs. Fifth, am I willing to sit with the discomfort that will come with pursuing this goal? Chasing a meaningful goal will sometimes make you anxious. This is perfectly normal. Sixth, can I hold this goal lightly? As we saw in Chapter 10, clinging to expectations is a recipe for disaster. Can you accept that you need to hold your goal lightly? When you start living mindfully, your goals might change. Living moment to moment may change you on a profound level. Many of us mindlessly go along with the goals society has set for us. We are told that wealth, good looks, and fame will make us happy. However, when you make mindfulness a part of your life, you'll probably start questioning these values. Your old goals may no longer fit your personal aims. It's okay to change your goals. Mindfulness improves decision-making. Have you ever felt torn between two or more options? Great news! Mindfulness can help you out. It can improve your ability to make sensible choices. Here's an exercise for decision-making. Here's how to make a mindful choice. First, be aware that you need to make the best possible decision, not a perfect decision. Acknowledge that you are in a state of confusion. Take a few deep breaths. Reassure yourself that you can only do your best. Second, tune into your goals and values. When decision-making is tough, it's often because two or more of your values are colliding. For instance, suppose you have to choose whether to leave your job. You might value loyalty, which makes you reluctant to leave. But you might also value ambition, which makes you want to seek different work. The best decisions support as many of your values as possible. Third, weigh each option carefully. Notice whether you tend to place more weight on emotional or intellectual factors. Mindfully encourage yourself to address the problem from both sides. Fourth, ask, what might I be missing here, and is there anything I'm forgetting? Be patient with yourself. You'll notice discomfort when you have to make a decision, which is why we delay them. When we make a choice, we're giving up a sense of control. We worry about making the wrong decision. Mindfulness helps you accept this discomfort, which empowers you to make more decisions in the future. You'll learn to trust yourself and accept the outcome of your choices. To summarize this chapter, you can learn how to balance mindfulness with long-term planning. Mindful goals align with our deepest values. Leading a more mindful life often prompts us to reevaluate our goals. Mindful decision-making involves taking a realistic look at all our options and making the best decision based on the resources we have. Chapter 12, Mindfulness and Relationships. Welcome to Chapter 12. Relationships can be hard work. The good news is that adopting a more mindful way of life can strengthen your relationships, help you resolve arguments, and generally feel happier around other people. In this chapter, we'll focus on romantic relationships. but the principles and exercises apply to friendships, family relationships, and even work relationships. What does a mindful relationship look like? At the beginning of your relationship, you were probably mindful of one another. You were on your best behavior. Unfortunately, once we've settled into a relationship, we often start taking our partners for granted. No honeymoon period lasts forever, but you can keep your relationship intimate and fresh by making a commitment to loving your partner in a mindful way. So, what does this mean? A mindful relationship looks like this. Both parties feel respected. Both parties feel as though their partner truly listens to them. Both parties know that their partner is interested in them as a person. Both parties know that their partner finds them attractive. Disagreements are handled sensitively but directly. And both parties understand that relationships require ongoing maintenance. Communication, the key to successful relationships. Poor communication causes resentment and misunderstandings. All too often, we don't bother to check that we've understood what someone else is saying. Or, even worse, we don't listen properly in the first place. How to be a great listener. When was the last time you spoke to someone who really listened? These folks are rare and popular. Imagine how much better your own relationships will be when you start interacting mindfully with others. Here's an exercise for mindful listening. First, when someone tries to start a conversation, make a decision. Can you give them the attention they need, or would it be better to delay the conversation? If it's the latter, ask if you can talk later. Second, when it's time to have the conversation, stop whatever you're doing and pay attention. Third, maintain eye contact. Fourth, try not to think about what you're going to say next. Wait until the other person has finished speaking. Fifth, hold back when it comes to giving advice. They might just want a chance to vent. Sixth, try to maintain an attitude of compassionate curiosity. Assume the other person is acting with positive intent. Listening is a key skill for mindful arguing. During tense conversations, pause before responding to a provocative statement. Rehearse answers in your head before speaking aloud. If you feel overwhelmed, excuse yourself for a couple of minutes. Judgments. Do you judge others? You're in good company. We also tend to jump to conclusions about someone else's behavior. For example, you may notice that your partner has left some crumbs on the table, and you automatically think, they're so messy and lazy. We don't have to get swept up in our judgments. Instead, we can choose to be mindful when they pop up. When you find yourself angry at someone, take a few deep breaths and pay attention to what you are thinking. Notice each judgment. Imagine it as a bubble floating away. This takes practice. Are you hoping that someone else will change? Given that we have enough trouble understanding and changing ourselves, it's foolish to expect someone else to change on demand. To put it bluntly, someone else's path is none of your business. So, if you think you'll be happy when your partner becomes more patient, it's time to adjust your expectations. Work on accepting them as they are. Your relationships will improve because you won't feel so resentful. Loving kindness meditation, which involves sending warmth and love to someone else, helps you accept and appreciate others. It also helps to see the other person as a teacher. When someone can't live up to your expectations, they are teaching you a valuable lesson about accepting life as it is. Paradoxically, when you decide to show someone compassion and acceptance, they are more likely to change. Mindfulness doesn't make you a human doormat. You may worry that you'll end up making too many allowances for poor or abusive behavior. However, being mindful isn't the same as being a pushover. In fact, mindfulness helps you assert your rights and pick up on signs of abuse quickly. When you are in tune with your emotions, you'll find it easier to maintain a realistic view of your relationships. You will choose partners and friends based on who they really are, not who you want them to be. To summarize this chapter, a mindful relationship is built on trust, respect, and a realistic view of the other person. Mindful communication, including mindful listening, will strengthen any partnership. Arguments are inevitable, but approaching them mindfully makes a big difference. Your relationship will improve if you accept your partner for who they are. Chapter 13. Making mindfulness part of everyday life. Let's begin the final chapter. Modern life is hectic, so how can the average person make time for mindfulness practices? In this chapter, we'll take a look at how you can weave mindfulness into your everyday routine. What does a mindful day look like? Don't try to do everything on this list. Instead, pick one or two of the habits and try to do them consistently for at least 3 weeks. Let's start with mindful mornings. First, greet the day with mindfulness. When you open your eyes, resist the urge to reach for your phone. Instead, take a minute to notice how you feel. Second, make your bed. It's an easy task that sets you up for the day. Third, have a mindful drink of water. Pay attention to the feel of the glass in your hand. As you drink, feel the water moving from your mouth to your stomach. Fourth, greet your partner, pets, or children in a kind and mindful manner. Try greeting them as though you may never see them again. Take a moment to feel grateful that they are in your life. Now for mindfulness during the day. First, spend time in a natural setting. 10 minutes in a park or garden will restore your mental equilibrium. Second, give yourself a mindful smile. Find a quiet place and look at your own face in a mirror. Look at it as though for the first time. If any harsh thoughts come up, label them as such and let them go. When you're ready, give yourself a smile. Third, let yourself laugh. Laughing is a form of mindfulness. When you laugh, you are grounded in the present. Fourth, eat and drink mindfully. Try to have at least one mindful meal per day. When you make a cup of tea or coffee, pay attention to the process. Fifth, use tech mindfully. Refer back to Chapter 9 for tips. Sixth, use mindfulness practices to overcome procrastination. Chapter 9 contains lots of useful exercises. Seventh, embrace waiting as a chance to practice. Next time you are stuck in traffic, use the time to put away your phone, take a few deep breaths, and notice what is going on around you. Now for easing the transition from work to home. First, end your day on a mindful note. Before you leave work, congratulate yourself for completing your tasks. Second, use a mindfulness ritual to help you switch off from work. For example, you could make a habit of slowly walking down the hallway when you leave, feeling your feet against the floor. Third, be a mindful commuter. Commuting is a perfect opportunity to practice mindfulness. Pay attention to the temperature, the view, and how it feels to sit in your seat. And finally, mindfulness in the evening. First, carry out your chores mindfully. Washing the dishes, cleaning the bathroom, doing the laundry. Most chores are a wonderful opportunity to practice using your senses. Second, take a mindful shower. As you step into the shower, notice how the air feels. Let the water hit your skin. Notice its texture, temperature, and scent. Third, review your day. Just before you go to bed, look back over your day and think about when you were most mindful. Fourth, practice gratitude before you go to sleep. Give thanks for all the good things that happened. Even if everything seemed to go wrong, you can still be grateful for the basics like clean water, shelter, and food. Be prepared. You've probably heard the saying, fail to prepare and you prepare to fail. This applies when working with habits. Take a moment to think about the barriers you might face. For example, if you want to start every day with a 5-minute gratitude practice, you might worry about drifting off to sleep. You could make it a habit to sit up on the edge of your bed as soon as you wake up. Get an accountability buddy. Do you know someone else who is interested in mindfulness? If so, why not suggest you support one another? Checking in with a quick phone call or text can keep you both on track. Taking your practice further. If you have time, set aside longer periods, say 20 to 30 minutes per day, for practice. When you make an appointment with yourself, honor it. If you feel resistance to scheduling time for yourself, think about why. Can you feel the resistance in your body? Does it feel selfish? If so, gently remind yourself of the benefits of mindfulness. Caring for yourself can actually help those around you. To summarize this chapter, to get the most from mindfulness, you need to make it part of your everyday life. You can practice at any time of day. Anticipate barriers and think of ways around them. An accountability buddy will help keep you on track. If you have time, aim for 20 to 30 minutes of practice per day. Don't worry if you fall back into old habits occasionally. Conclusion. Congratulations, you've discovered how to live in the present. The daily grind is no longer quite so joyless now that you can find contentment in every moment. Your relationships will blossom as others feel drawn to your positive energy. The more time you make for your mindfulness practices, the lighter and freer you will become. When you feel yourself slipping into mindless behavior, you will pull yourself back to reality within seconds. Your family, friends, and colleagues will soon notice the shift in your outlook. They will start asking for your secret. Point them in the direction of this audiobook and encourage them to experience the power of mindfulness for themselves. Mindfulness has the power to heal the world. If we all took time to notice and accept our emotions instead of acting on impulse, imagine how things would change. Everyone would be kinder. Relationships would be easier. Society is gradually waking up. You are now part of this movement. Isn't that exciting? You may only be one person, but your actions have a ripple effect. Treating yourself and others with quiet appreciation and respect softens your attitude to life. You will start seeing opportunity and blessings wherever you look. Sure, you'll come up against challenges, but you can handle them. From now on, your mindfulness practice is your refuge. Open at all hours of the day and night. Whatever happens, you'll always be able to surf even the biggest of waves. Embrace change, show compassion to yourself and others, and treasure this moment. Ultimately, it's all any of us have. This has been an audio adaptation of the book Cognitive Behavioral Therapy and Mindfulness, 2-in-1 Bundle by Olivia Telford. To support the author, you can purchase the original book through the Amazon link in the description. Your support helps bring more valuable content like this to listeners. Thank you for listening.